is going to get priority, and Alexis is going to ask Mary if she can go to OSJ the next day. So it's just one of those things. We're going to make sure that those medical appointments receive priority, but we're going to do our very best to make sure that people get to where they need to go. In order to take advantage of these of the transportation program, we just need to do an intake form, which is essentially demographic questions and kind of a deep dive into your driveway, so our drivers know what to expect. And it's super easy, and you only have to do it one time. Each week, we have a set driving schedule, aside from all of the other various rides that are going on. So Mondays and Thursdays, we go to Stop and Shop. Or Mondays and Thursdays, we go to Chatham Village Market and we'll deliver grocery orders to your home as well as prescription. Thursdays, we go Stop and Shop, and a new offering this season. Every other Tuesday, we'll be taking a ride to the Chatham Farmers Market down by the church, which will be really cool. So if anyone's interested in taking advantage of that, please give Alexis a call. Okay, now the fun thing to talk about is our programming. I have broken up these are all pictures from programs that have happened over the last year. In this category, you're seeing arts and entertainment, as well as some recreation and socialization. These are all kind of combination. We've got some education, programming, community engagement, and then health and wellness. So our programs are growing every single month, and it's been such a fun time for me to try and come up with new ideas. My ears are always open, but we have a lot of offerings. We've added a lot of things to our calendar, and we'd love to have new faces come in and check those out. This picture, some of you may be familiar with Gail Tilton. She's our Wellness Warriors instructor. And she was also recently an Artist of the Month. That's been a new program that we've kind of incorporated into our schedule, where any community members can come in and display their work and have a little reception and invite their friends and see their work hanging on the wall and talk about it. That's been really great. So if there are any artists out there, please give me a call. Some of the community engagement opportunities, we just went to the Liberty Artisanal Bakery a couple of weeks ago. That was really cool. We got a back of the house tour of what that bakery is looking like and kind of a sneak peek. There's a picture down here of us. We're at the Chatham Harvesters Test Kitchen getting a cooking demonstration, learning how to cook squid so that it tastes good. And that was really fun. We've had visitors from the Mass Audubon, bringing in their little furry friends, which is lovely. And up at the top of the corner, something I'll plug for you guys. That's our sound meditation class. I don't know if anyone in here has taken advantage of that, but it's essentially a meditation class fueled with sound and those Tibetan crystal bowls. Very relaxing. We have our instructor, Ashley. She's going to be giving a sound meditation twice a month, starting in July. And that's just a great opportunity to kind of relax, meditate, get back to yourself a little bit, which is really fun. Some of the other programs that we offer are education based. So a big popular one is our Lunch and Learn program. Every month we do a Lunch and Learn where we have lunch and we learn about something new. That can range from a whole bunch of different things. We have had scam prevention speakers come in. We've had audiologists come and talk about, the ears and all of that. We have Pat Burke, one of our Shine counselors. She comes in and does an open enrollment presentation every fall, which is the health insurance from October to December, that open enrollment period. Comes and talks about that. So we have a lot of different opportunities at the CFAL, and I'm sure all of you guys are sitting here wondering, well, what's going to happen when the building starts being renovated? Nothing will change besides our location. I am going to do my very best to make sure that our programming remains as robust as it is today, by taking advantage of the space that the community center has so graciously welcomed us into. Our programs will remain continuing throughout that expansion and renovation project. So not to be concerned, we will be based in the community center. Right now, our health and wellness programming is here. Our chair yoga, our full body fitness, previously our indoor walking group. Everything that is based in this building will remain here, and we'll bring our other programming here. So this will become our central location. And I'm sure there are also people right now wondering, well, what about women's club and men's club and garden club and the hospital auxiliary and all the things that are happening in the building? we're going to work together to try and just zipper everything, all the offerings and programs, so that it's seamless and nobody's getting pushed off to the side. We are going to work as diligently as we can to make sure that everyone is happy. So, not to fear. Nothing will get flipped over and forgot. All right, I'll zoom through here. Chatham Better Together is, I think, my favorite program, but don't tell anyone that. Keep that to yourself. Chatham Better Together is a group of individuals where we once a month will go and do something new. So last month we went and toured the water treatment facility. We've gone to the Witta Museum. We've gone and checked out the new Cape Tech building. Chatham Better Together is just an opportunity for individuals in our community who are wanting to be connected with others to do that and form bonds and friendships. And each month we go and do something different and then enjoy a lovely meal together afterwards. If you guys have any questions or any individuals in town that you think may benefit from being a part of a group like this, please let me know. We're always welcoming new members and are excited to try and form more connections with one another. So, and our volunteer program, we have grown the volunteer program from 14 people to 35 in the last year, which is really great. This is from our volunteer appreciation event in April. You can see here volunteers from all different walks of experience or opportunity. So we have board members, we have Shine counselors, we have our knitting circle leader, and it's reflective of all the different ways that you can get involved at the CFAL. So if you have any questions about the volunteer program, I'm your girl. I'll be here all day. You just let me know. If you guys have any questions, I would love it if you write it down, because I am going to turn it over to Mike. He has a very important presentation to share with you guys. And yeah, thank you so much for listening to me.
My name is Mike. I'm the EMS captain for the Chatham Fire Department. I've been on the Chatham Fire Department since about 2016. And a lot of what I do in terms of community outreach is I teach CPR and stop the bleed classes, as well as provide education on other stuff that Rachel's going to cover later. She does a great job with that as well, so we work closely in tandem. The purpose of today's presentation, we're going to focus on a couple basic medical emergencies. It's by no means an exhaustive list, and it's not intended for you to rule out if you are having an emergency. It's just to make sure that you guys are aware of some of the more common and more dangerous signs and symptoms that you might run into. And then we're going to talk about afterwards some things that we can do in terms of CPR and stop the bleed that have a really good outcome if done early, that you guys can do before we arrive. At any point in time today, if you guys have questions, feel free to write them down and wait. Or if you'd like, just raise out your hand and call it out. We'll get to it at the time. So we're going to start with a couple different things that we want to talk about. Now, I'm sure you've heard about these. We're going to start with acute coronary syndrome. That's something that's talked about often, usually referred to as a heart attack. So what you see here is a picture of a heart. I know a lot of people, when they think heart, they think Valentine's Day and that nice little picture that you have, the pink heart. Ours looks a little bit different than that, and you can see a picture on the board. There's some basic circulatory stuff that we should know about in terms of how the heart works. So the heart supplies the whole body with blood, but it also supplies itself with blood, and it's the first thing that it goes to. So you can see the picture there. We have right coronary artery and left coronary artery that wrap around, and they provide that oxygen to the heart so that it can pump. Acute coronary syndrome is a spectrum of disease, and there's different levels to it. But basically, at a very entry level, what it means is that the heart is not getting the oxygen that it needs in order to continue pumping effectively. The heart is a muscle just like your other muscles where it needs oxygen in order to work, and if it stops getting that oxygen, it starts to get injured, and it eventually will die. And once it dies, it cannot come back. So it's important to remember that with this, as well as the other injury that we're going to talk about, time is very important, because that time is something that you need and you may not get back. So early recognition is what we're pushing with here. So these are kind of the three big phases of what we would call acute coronary syndrome, the three different types. Down at the bottom, we call it stable angina, and this is your chest pain that comes and goes. You get up, you're walking up a flight of stairs, you're outside mowing the lawn, you're moving around, you're exercising or exerting yourself. That's what brings on the pain. So it's usually comes on with activity or stress. It's usually relieved with rest. So this pain will go away if you stop whatever it is you're doing that is causing it. So that's where it starts out at the beginning. The next level above that is called unstable angina, and that's basically even more decreased blood flow to the heart. And this is usually not relieved with rest. So if this is brought on by stress or exertion and you stop and the pain or the symptoms persist, that would be classified as unstable angina. The next level even above that is what you guys probably hear about a lot when you hear about heart attack. That is a myocardial infarction, and that is true death of the heart muscle. So that is death brought on by lack of oxygen, and that cannot be reversed. And that usually presents a little bit differently. We in the pre-hospital setting, if you were to call us for chest pain or some form of complaint, we're going to show up. We bring in all sorts of equipment. Some of you have probably seen us. We don't travel very light. We'll bring in our cardiac monitor. We'll bring in a bag with all sorts of equipment and medications, and we check a bunch of stuff. So we'll check your vital signs. We'll check your heart rate. We'll put you on our monitor, and what we're looking for is changes in our machine, our EKG, that might indicate that you are having an MI or a myocardial infarction. We cannot 100% rule out that you are not having one, but we can see some changes that are big red flags for us that you may be having one. And that's what we look for when we come to your house. We'll take a look at that. As far as treatment goes from us when we show up, now some of you may have a cardiac history, you may know some of this. We usually will treat it with aspirin. We can give you nitrates or nitroglycerin. That helps kind of reduce the workload of the heart and buy us a little more time so we can get you to where you need to be. We can also give you pain management, so we can give you some medication for that chest pain because it can be very potent. And we can give you oxygen if that's what's necessary. That can help kind of give us a little bit more time for your heart tissue so we can get you to where they can fix the problem. Once that problem is identified, we're going to bring you to Cape Cod Hospital. And for those of you guys who don't know, Cape Cod Hospital is a primary PCI, which is percutaneous coronary intervention. What that means is they can go in, they put you on the table, they put a catheter into your leg, and they can go and fix the problem. They can also do what's called a coronary artery bypass graft, which is what they would do if the problem is not able to be fixed with less invasive means. So Cape Cod Hospital was one of the foremost on the forefront of this research when it first started about heart attacks and how they can fix them, and it is still a fantastic facility for that. And that's where we're going to bring you guys. The point of this isn't necessarily to make you more nervous about what's happening. It's just to make you aware that these symptoms may present, and they may present differently, which is what we're going to talk about next. So some of the basic signs and symptoms you might see: central anterior chest pain. So when we talk about chest pain, if any of you have ever seen a commercial, you see somebody clutching their chest like this, they're making a fist, and they're complaining about that chest pain. It can also present with chest pressure, tightness, that feeling of an elephant, someone sitting on your chest. Crushing pain, it can radiate to the arms, neck, back, or jaw. That is sort of your classical presentation, and that's usually a good indicator. Most people, when they feel those signs and symptoms, they know to call 911 because they think something's wrong, right? There are other symptoms that can be a little less obvious. We think about shortness of breath, so you feel like you're having trouble breathing, general weakness, syncopal episodes or fainting, dizziness, heart palpitations. Those can also be signs and symptoms of acute coronary syndrome. And then even further down, epigastric discomfort, nausea and vomiting, things you may not directly associate with a heart attack, but things that can be indicative of you having one. And then even below that, diaphoresis, so that's basically sweating. Anybody ever experienced that? You get a flop sweat, you feel very pale, sweaty, that can be a sign. Women can present atypically more commonly than men, which leads to women usually being underdiagnosed with acute coronary syndrome because the symptoms often go ignored. Men, we're easy, right? I'm having a heart attack. It's simple, it's crushing. Women can be a little more complicated. The point for that is don't ignore symptoms that you may have, right? Make a point to get it looked at. If you're concerned about it, call 911 and we can come check you out. Some risk factors. These are things that increase the risk of you having acute coronary syndrome. Smoking, high blood pressure, high cholesterol, diabetes, or a family history. When we come to your house, we will interview and we will ask you a lot of these questions to see if any of them are present. Family history is a big one. Has anyone in your family ever died of a heart attack? Yes, my father died at 65. How old are you? 65. It's a big red flag for us, right? We're probably going to take you to the hospital. So we ask you all those questions just to kind of build a better picture of how likely it is that that's what's going on. We are almost always going to recommend that you go to the hospital to get checked out. If you felt sick enough or nervous enough to call 911, we're on your side. We are patient advocates. We want to make sure that you get checked out and we rule out something significant happening. Doesn't mean you have to go if you call us. It's a common question we get is people say, well, I don't want to call 911. I don't want to go to the hospital. You don't have to go. We can come check you out. and we'll present you with what we find and what we think, and you can still make your own decision as to whether or not you want to go or not. Any questions on this so far? Yes? So we don't typically have any follow-up. If someone refuses, typically we go through what's called an informed refusal. We present you with what we found, what we think, your rights to refuse, but we also are very big on presenting you with the consequences. Not necessarily to scare you, but we want to make sure you understand that based on what we're finding, this is what could be going on with you, and this could be what the end result is. We can't say for sure. We're not doctors. We don't have all the tools that they have, but that is how we make sure that you can refuse, and a lot of people don't want to go to the hospital, right? They've been there before, or they just don't want to leave their home. That's fine. We don't have really a system for following up. There are programs in town for something similar to that I believe the police are going to talk about, but it's a little bit different than what we do. We typically don't have scheduled follow-up. Does that answer your question? Any other questions? Okay. Just remember that this is not a list of all of the symptoms. So if something is not on this list, doesn't mean it can't be used to rule in or rule out. This is just a list of the ones that we look for that are more commonly associated with it and a little bit more significant. The next thing we're going to talk about is stroke. And this kind of goes hand in hand with acute coronary syndrome, and that this is an issue with blood flow being restricted to where it needs to go. Typically in this case, a clot or a bleed disrupts blood flow to the brain, to a specific part. It can be a small part or a large part, depending on where the clot or the bleed is. And this can lead to brain cell damage. As you can imagine, your brain's pretty important. It requires a lot of fuel to function properly, and an interruption to that can cause significant issues and symptoms, and that's what we're going to look at. There's two types of a stroke. There's an ischemic stroke and a hemorrhagic. An ischemic stroke, basically a clot, is a blood clot either forms or travels to the artery in the brain and causes that obstruction of blood flow. Hemorrhagic, which is basically a bleed, it ruptures or can be caused by trauma and causes bleeding in the brain, which can cause that same restriction in oxygen. So those are the two types that we deal with, and you can see up there, ischemic strokes represent about 80% of the strokes that they find. Hemorrhagic is the other 20. For most part, for us, there's not a lot we can do for a stroke. This is a really complex medical emergency that needs definitive care. So for us in the field, when we come and we find you and we see symptoms of a stroke, we're going to be providing supportive care. Oxygen, fluids, medication management, so pain management, but we're not going to be doing a whole lot because it's a little bit beyond our scope. Again, very important the time of this, because the longer that obstruction is present, the longer that blood flow is blocked, the more damage is done, and the less chance there is to mitigate or reduce that damage. It becomes more permanent. So we always say time is tissue, because it's very important that once this happens, the clock starts ticking as far as what they can do for you in the hospital. Any questions about that? Remember, this is a very basic overview. Yes? Ooh, good. So that's on here too. So a TIA is called a transient ischemic attack. And what that is it's something that can mimic the symptoms of a stroke, and we'll talk about the symptoms next, but the symptoms then resolve suddenly with no intervention. So you may have some of the symptoms that we'll talk about, and then they go away. This is the perfect time to skip ahead, because an important part of this is even if the symptoms have resolved, it's important that you look for emergency, because the symptoms of a TIA can be indicative that you have a higher risk of having a full-on stroke. So if you do have a TIA and the symptoms go away, say, oh, I'm fine, I don't have the symptoms anymore, that is a big indicator that you are at higher risk for a stroke. So it's important that even if they go away, you call us. And most of the time, even if you say my symptoms have resolved, we're still going to recommend you go to the hospital for a full workup, because that's a big red flag. That symptom's going away, but they're very likely to come back. Does that answer your question?
Yes.
Good. So a couple different things for this. They don't do a lot of intervention at the hospital for this specifically. Stroke centers, I think the closest one is up in Boston. You're probably going to get transported to one of those. But Cape Cod Hospital has telestroke capabilities where they will go in, they will do a CT scan, they will evaluate you, and you'll consult with a neurologist to see if you need to go somewhere else. All the more reason that this is one of those time-sensitive, if you see it and you find it and you recognize the symptoms, it's very important to act early, because that's your best chance at a positive outcome. There's a couple things they can do for this in the hospital. We'll talk about those a little bit. This is a picture of the basic circulation in your brain. So similar to the heart, there's a lot of complex stuff that goes on in there. This blood flow, if it's restricted anywhere, can cause symptoms. Now, depending on where the obstruction is, can change the nature of the symptoms. The larger the vessel is that occluded, the more severe the symptoms are. And that's what brings us sort of to the recognition point, where they always talk about the acronym of FAST. Has anybody ever heard that before? Good. We'll cover that in a second, but that's a big one. That's indicative, those signs are large vessel occlusions, which means there's a big blockage in a big artery that's going to cause a lot of damage. So those are the ones that are a little bit easier to recognize, but we're still looking for the similar signs and symptoms. So before we talk about the FAST acronym, these are kind of some of the symptoms that we pre-hospitally look for that for us indicate stroke. And you can see in front of them, the big number there, the big item there is sudden. That sudden is an indicator for us that something acute is going on, not necessarily a chronic issue. Sudden numbness, weakness, or paralysis in the face, arm, or legs, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden severe headache with no known cause. Sudden loss of balance or coordination, as well as sudden dizziness. So these are big red flags for us. If we come to your house and we're evaluating you and you have one or more of those symptoms, that's a red flag for us that there could be a stroke. And that's what we would look for. Risk factors, you can see there's a lot of similarity in this list to the acute coronary syndrome list. Smoking, heart disease, high blood pressure, high cholesterol, diabetes, and a family history are all risk factors that increase the likelihood of you having a stroke. So it's important to understand if you have one or more of those, we're going to be even more concerned that you may be having a stroke. We talk about our spotting a stroke acronym called FAST. The F stands for face drooping. Typically one side of the face will droop. You won't be able to, they'll always ask you to smile. Hey, can you smile for me? One side will and the other side will not. Arm weakness. Are you able to move both arms normally? Is there weakness or drift in one side of your arm? Speech difficulty. Are you noting some slurred speech? Trouble saying or recognizing words? Incoherent words? Words that don't necessarily make sense? It's time to call 911. So that's a quick test that we also use in the field to kind of check and see if you have any of those bigger issues that would be indicative of a stroke. And that's something that we look for. Any questions? Yes?
Yeah, if you have a stroke, is it more on the, I'm going to say, outer layer of the brain versus inner layer of the brain? If that makes sense to you, what I'm saying, asking?
I don't have a good answer for you, unfortunately, as far as where it is. The mechanism of the stroke is typically that obstruction to whatever part of the brain that blood vessel feeds. So wherever that block is, the part of the brain that is fueled by that artery is what's going to suffer. Yes, ma'am.
Could you say a little bit more about the being impacted and what that is like?
Yeah, so trouble seeing is a common one. Again, based on where in the brain the injury is occurring, can affect your vision. And that can be double vision, sensitivity to light, loss of vision. Those can all present as symptoms of a stroke if they happen, usually if they occur suddenly. And that's usually the big indicator, again, is that suddenly. Things that progress slowly over a number of days or weeks are not as indicative of a stroke as things that happen right away. It's usually that sudden change that we look for. So typically the big one is double vision or sensitivity to light, usually the more common ones. Any other questions? Yes, sir.
Do you have a method to actually diagnose or determine that in fact a stroke has occurred, or is your conclusion based on these symptoms and the patient's presentation?
Could you repeat his question?
Yeah, so the question is, do we have the ability or a method of diagnosing a stroke, or do we just use these symptoms? So we, in emergency medical services, we don't typically diagnose. We don't have the capability of diagnosing stuff that the hospital does. So we work based on a system of symptoms. So what we're going to look for is, do you have the symptoms that we would look for that are indicative? And we usually rule in or rule out. So if you have any of the symptoms that indicate that you may be having a stroke, we are going to operate under the impression that you are having one until we can rule it out. The hospital will do scans, they will do blood work, they will do a consult with a neurologist, they will do a much more in-depth assessment to see whether you are truly having a stroke. For us, it's, could you be having one? Yes, then we need to get you to the hospital so that they can figure out whether you are or you are not. So we don't have any definitive tests. We have tests that are more likely than not. If we perform these tests on you, these scales, that say if you have these issues, it's likely that you could be having one, but we don't make the kind of decisions whereas doctors would do, different types of testing to determine that you are in fact having one. And that's usually done with imaging and blood work. Does that answer your question? Yeah. So and in general, with all of this stuff, we don't operate on the, you are having this. This is definitely what's going on. Ours is, you are presenting as if you are having one, so we're going to treat you like that and bring you to the hospital where they can then make the definitive diagnosis. And even some of those diagnoses aren't as definitive. The hospital, they do all the tests that they can do, but they may not have a definitive answer for it. But we are very much, this is what we think, and we're going to act on that impression. Because if you are, you need to go to the hospital. If you're not, that's best case scenario, but we want to make sure that we check and make sure that you get the care that. So, what do you guys do, right? So if this happens to you, what are the steps that you're going to take? First thing is call 911 immediately if you notice someone experiencing, or if you yourself are experiencing any of the signs and symptoms, even if they have resolved. So even if they have resolved, it's important for you to make sure that you notify us so we can come check you out and make sure that, hey, we think you should go to the hospital. This looks like it might be serious. We want to make sure you get checked out, right? It's important that I don't want to be Chicken Little and say every ache and pain is going to be a significant emergency, but I want to make sure that you're aware of what should jump out at you if it is happening, that it could be a medical emergency. So as far as prevention goes, I'm not a doctor, right? So always consult your physician for any medication changes or anything like that, but these are typically the things that they see that decreases your risk. Controlling your blood pressure and cholesterol levels, whether with medication or exercise. Doctors are really good at prescribing that, giving you an exercise regimen. Managing diabetes. Unmanaged diabetes can increase your risk of all of these emergencies. So it's important to make sure that if you do have it, it is managed properly. Smoking. I don't want to be on a pedestal, but smoking increases the risk of basically everything. So when you stop doing it, everything gets a little bit better. Regular exercise, whether it's walking. Pickleball is popular now, I hear. I haven't played it myself, but I hear it all the time. Anything that gets you up and moving around that can help you keep exercising is great for you. Sleeping, loss of sleep deprivation can cause a lot of problems if you're not getting the proper amount of sleep. And then seeing a doctor regularly for checkups. People necessarily don't go to doctors all the time, and it's possible for something to develop that you missed, and that can cause you to have an increased risk for some of this stuff. So make sure you're getting your checkups regularly, consulting with your doctor. Right? Most of the time, if you call your doctor with any of these symptoms, they're going to tell you to hang up the phone and call us. So typically, if you have any of the symptoms we discussed as far as the chest pain, the shortness of breath, the dizziness, and you call your primary care physician, they're going to say hang up the phone and call 911 because those are risks for what we talk. Any questions? We get this a lot. People call 911 or they call the business line and they say, well, we don't want to bother you, but, right? You're never bothering us. This is our job. This is what we get paid to do. We like what we do. We want to help. Please don't ever feel like you're bothering us calling 911, even if it's just for some symptoms that you're not 100% sure about. We are more than happy to come check you out and provide some vital signs for you. We'll give you our opinion on what we think is going on, as well as give you some peace of mind if it is indeed something. Say, hey, it might just be, some toe pain. It might just be toe pain, but we'll come rule out any of the big stuff, or at least give you some advice on that. So don't ever hesitate to call us. So let's say that this happens and it progresses and becomes worse. Well, then what can you do about it? So the next thing we're going to talk about is CPR, or cardiopulmonary resuscitation. So this is basically when the heart stops beating effectively and no longer supplies blood to the body. And this can be a result of any number of things, but eventually all roads lead to this in terms of the end game. So we're going to talk about some basics for you guys, and this is not a full CPR class. This is not a certification. This is more of just an awareness. But we're going to talk about what you guys can do to buy some time until we get there. So there's a few things that we're looking for. We check responsiveness, okay? So we don't check for a pulse anymore. We do, but the layperson bystander CPR does not because it ended up taking too much time. And as we talk about, time is tissue. So you're going to check for a response. And we'll go through this, and then I've got a lovely mannequin over there that I'll demonstrate so you guys can kind of see the process. You're going to check to see if the person is responsive or not. Now, if any of you have ever seen or had or witnessed someone having a syncopal episode, they pass out, they fall to the ground. Shortly thereafter, they usually wake up, they come to, they ask what happened, but they're generally okay. We want to make sure we check that they're responsive or not. There's a difference between that syncopal episode where someone's alert, they're responsive, and they come back, versus cardiac arrest where they're not responsive at all. Responsiveness means moving, blinking, speaking, or any kind of reaction at all is responsiveness. So this table, hopefully, is not responsive, okay? You guys, if I walked around and poked you, I'd probably get a variety of different reactions, but you guys are all responsive. So that's what we look for our first criteria. Our second criteria is no breathing. So we're looking for no obvious signs of normal breathing. If you see gasping, which is this kind of short inhalation of breath called agonal respirations, they're usually pretty far apart. They can sound like snoring. We're going to treat that as if they are not breathing. So what we're looking for is obvious normal breathing. If I look and I see that your chest is rising, your stomach's rising, I can hear air moving, that's normal breathing. If I don't see that, I see the agonal gasps or I see no breathing at all, I'm going to say that's no breathing. So if we have 2 no's, we have a go. Right? So no response, no breathing, go do CPR. Does that make sense? So we want to make it as simple as possible because this can be obviously very stressful, and we want to eliminate all the factors that may make you uncertain of what to do. The risk of doing CPR on someone who doesn't need it is much less than the damage that can be caused if we don't do CPR on somebody that does. For about every minute that someone in cardiac arrest does not get CPR, their chances of survival drop by 10%. So for every minute, 2 minutes, 3 minutes, multiply that by 10%, and that's their chances of survival to discharge drop by that much. So the importance of bystander and early CPR cannot be understated. CPR, what we think about is the act of compressing the chest and providing oxygen via mouth to mouth to restore blood flow until the heart can be reset. So all we're doing is we're basically pretending to be a pump, and we're pushing on that chest and we're moving blood around to get it to where it needs to go until we can figure out what the problem is with the heart and we can fix it. And that's typically going to be done by the AED or us when we show up with our monitor, our cardiac defibrillator. Any questions on that? Sounds simple, and it is simple, but there's some other stuff with it. Any questions before we get started? Okay. So there's 3 main goals with our compression. We want them to be deep enough, we want them to be fast enough, and we want to have full recoil, right? So has anybody ever used a siphon to pump gas? Any hand pump? Right? If you squeeze it, it fills, you squeeze it, it pumps gas out. If you don't let it fully expand, it doesn't fill all the way, you're not going to pump as much gas out. So it's important to let that refill all the way. If you don't squeeze fast enough, it's too slow, you're not pumping enough blood. And if you don't squeeze deep enough, you're not going to get enough force to pump that blood around the body. So those are our 3 big things that we're looking for. So when we do CPR, the first thing we want to check for is make sure that the scene is safe. So we're going to take a quick look around and make sure whatever is going around, it's safe for us to go help. We in the fire department, we're trained to operate at a different level of risk than you guys are. We're going to operate in the streets and traffic with police help. We're going to operate in maybe semi-dangerous environments. We don't expect you guys to do that. We want to make sure your first priority is your safety. So you need to take a look around and make sure that it's safe for you to help. Does that make sense to everybody? So just a quick look around. It also helps you take a deep breath and stay calm, right? The next thing we're going to do is we have to have a victim. So in this case, the victim is our mannequin. So, scene safe. We have found somebody on the ground, whether it be a loved one, a friend, family, or a stranger, and we know that there's a problem. The next thing we're going to do is call 911, right? So you know that there's a problem, you have somebody down on the ground, call for help. If you're by yourself and you have a cell phone, call 911, put the phone on speaker, and then follow the instruction. If you're by yourself and you don't have a phone or any way of shouting for help, you're going to leave and you're going to go get help before you start doing anything. Does that make sense? So if you're here and you find somebody and you're on a walk in the woods and there's nobody around to help, we've got to go get help first. Okay? If you can shout and somebody comes to help you, now we can start to work. Okay? So the next thing we're going to do is check responsiveness. Now we talked about what it is, but how do we check it? Well, the first thing we do, are you okay? Are you okay? No response, right? Obviously, we're not going to get a response from this guy. That's what we're looking for. No response. Then we're going to check for breathing. What we're going to do is we're going to scan for 10 seconds. So we're just going to look and see if we have any of those signs of breathing. Do I see any chest rise and fall? Do I see any belly movement? Do I see any nasal flaring? Do I feel any breath? Do I see any signs of normal breathing? If the answer is no, then we have someone who's not responsive and not breathing, so we're going to do CPR. Okay? The way we do CPR, first thing we think about is hand placement. So when we look for hand placement, we're going to think center of the chest, lower half of the breastbone. Breastbone runs from the sternal notch down to here where you can feel it go from firm to soft, and we're going to go in the lower half of that. Doesn't have to be perfect, just has to be close. Okay? We're going to interlock our hands. You can either overlap or interlock, but we're going to use this heel, and that goes on that breastbone. We're going to lock our arms. We're going to put our chest over our patient, and we're going to push hard and fast. Who knows how many of these we're going to do? Mark in the back. 30. Excellent. Have you taken this class before? So we're going to do 30 compressions. Then we move over to breaths. Okay? We're going to check head tilt, chin lift. So we're going to position the airway in that sniffing position, which is basically just making sure that we're opening up that airway. You're going to pinch the nose so that no air comes out of that. You're going to seal your mouth around the person's mouth, and you're going to deliver a breath. A couple things that are important here, making sure that when we deliver that breath, the only thing we're looking for is chest rise. Everybody's got different sized lungs. A big breath for me might be a little breath for you and vice versa. As long as we see this chest rise, that's how we know we've delivered a breath. We don't want to give too much, we don't want to give too little. Pinch the nose, deliver a breath, deliver a second breath. We're going to give 2. 30 compressions, 2 breaths. Once I deliver my breaths, I'm going right back to compressions. All right, so this has a click. This mannequin will have feedback. That's obviously not going to be the case in real life, but remember, we're looking for those 3 things. Deep enough, about 1/3 the depth of the chest, fast enough, that 100 to 120 beats a minute, and allowing full recoil. So that's the difference between full recoil, which is this, versus if I'm not letting the chest compress and rise, I'm not going to let that heart refill, and I'm not going to be pumping as effective. Any questions so far on this? Yes? It can. Everybody is capable of delivering an effective compression. It just might take a little more work. Smaller people might have a little bit more of a tough time, but they're still able to do it. It's just going to take more energy. I happen to have a little bit of mass, so doing compressions for me is a little easier than it is for some. But everyone should be able to do it. That's just going to be a technique, and that's going to be kind of dependent on who's in arrest and who's doing the compression. Does that answer your question? Anything else? Everybody good on that? So compressions, yes? Yeah, no, you're stealing my thunder. We're going to talk about, there's a list of songs on the AHA's website that you can play in the event of a cardiac arrest that have that 100 to 120 beats per minute. Staying alive is a very common one, so is Another One Bites the Dust, ironically enough. So there are a list of songs that, if you think about those beats in the background, that song is the appropriate pace to be doing compression. Now remember, there's no CPR police, so no one's going to come fault you for doing it a little too slow or a little too fast. The general motto for this is anything is better than nothing. We just want to get close. Doing those compressions is going to buy time and get us to the next part, which is the AED. And we'll talk about this. How many of you guys know where an AED is in town? Anybody? Good answer.
Right at the top of the stairs and right at the bottom of the stairs. It's bright red. Can't miss it.
Yep. So very important to make sure that wherever you are, you're generally aware where there may be an AED. There's one at the town info booth. There's one at the fish pier. In quite a few places we have them. But if there's a place you spend a lot of time, it might be a good idea to get familiar with, hey, does this place have an AED? And if it does, where is it? Okay. So the AED is very complicated. It has 2 steps. You turn it on, and you follow the instructions. Now that might be grossly oversimplified when it comes to doing cardiac arrest, but that is the gist of it. The AED, all modern AEDs, including the one I'm going to show you that tests, will give you instructions on how to proceed with this step. And it's very good at knowing if you've done the steps or not. The other person that's going to be giving you instructions is whoever you called on the phone. 911 dispatchers are trained in emergency medical dispatch to give you instructions on how to perform CPR in an emergency. Now, they're very basic, but they're better than nothing. So if you call 911, they're going to dispatch us, and then they're going to stay on the phone with you and say, okay, is the person conscious? Are they responsive? No. Do they appear to be breathing? No. Okay, place your hands on the center of their chest, lower half of the breastbone, and start pushing hard and fast. And they're going to walk you through all the stuff we talk about. That's why that's such a good resource, is putting that phone on speaker and talking to them. Okay? Couple things with the AED, some basic steps. We need to expose the person's chest. We can do CPR over clothes. We cannot use the AED over clothes. So if we start doing compressions on somebody and they have clothes on, that's fine. If we get to the step where we're using the AED, we have to remove any clothes that cover the chest. Most AED kits have a pair of scissors that allow you to cut through anything that's in the way and move it to the side. You're going to apply the pads as indicated. They're going to give you instructions on where to apply the pads, and I'll show you guys that each pad has a little picture of where it's supposed to go. Important is not to touch when it says not to touch. That AED is looking for a couple specific heart rhythms, and if you're touching the person while it's analyzing, you can disrupt that analysis and cause a false reading. Press shock only when instructed. All right, a lot of people, as soon as they hear it, they start pushing the shock button, but you got to wait until you're told. The AED has to charge in order to deliver a shock, so it's going to take a minute for that to build up the amount of energy that it needs. Okay? So then you're going to follow the instructions and do CPR. And I'm going to show you guys, but any questions before I do? Yep.
Remember, I did the Citizens
You
Fire.
did, yeah.
And
He's my plant. He's
I
asking
don't
all the right
quite
questions.
remember, you know, where you actually had to put the pad if there was somebody had a
Pacemaker.
pacemaker.
Yep. Yeah, so pacemakers have changed a lot over the years, and a lot of them you can't even see anymore. But if you do see an obvious medical device, it'll be in the skin of the chest. It's about the size of a deck of cards. It'll appear like a lump. We just go as close to the spot we're trying to get to without covering that device. Does that make sense? So if you see a lump here and this is where the pad's supposed to go, just move it around a little bit to get as close to that spot without covering that. Any other questions? Yes? Yep.
Battery replacement.
Yes. Oh yeah, just like anything else. The batteries die, everything goes, they need to be checked. The AED pads have expirations. Most of them are very good at notifying you when something's wrong. They become very annoying and they beep. So you'll notice when an AED, well before it becomes non-functional, the AED will start to beep to say change batteries. Most of them will have a little screen, and you can see on that screen whether it's a check mark or a red X. The machines usually self-test themselves every day at a specific time to determine whether or not everything's functioning properly. If you see a green check mark, typically that AED is okay. If you see the red X, it usually means something has to be changed, whether it's the pads or the battery. There's various ones around town. Most of the departments, there's somebody on that department who maintains their AED. If they need stuff, they either buy it themselves or they call me and we restock the supplies for them. But yeah, they're very good at keeping an eye on that they're working or not. So yeah, usually they have to be maintained, but they do a very good job. Yes?
That you could have one at your home and that would automatically, or you would get it connected to the fire department, so not call 911, they would know in advance. Do you recommend that?
That is a difficult question to answer. They are very expensive. So having one at your home for, I don't want to say an unlikely event, but it is not a common occurrence. So spending that kind of money to maintain it and use it, that's going to be a judgment call for you as far as whether you want to spend that money and have an AED in your house. Yeah, it's tough to tell. So I would say there's enough of them around that you have one fairly close by. Plus, we travel heavy. We have all sorts of fancy equipment as well. Usually they're put in places that people assemble because that's the most likely spot for something like that to happen. That's where they have the best benefit. I have not run into one that notifies the fire department specifically when it is used, but I know there are programs out there where that's possible. Any question? Okay. So they do, some of the newer ones have the ability for you to monitor the AED wirelessly to see its status. So you could log in and say the AED's battery is good, the pads are not expired, stuff like that. But as far as the program where they notify directly, I have not seen anything myself if that's widely used. Depends on the brand. The question is how expensive are they? AEDs can run anywhere from several hundred to several $1,000s for an AED. We are lucky in town. A lot of the ones that we have are the same manufacturer, Zoll, and that's what we use at the fire department. The only reason for that is that that's what we have, so if we show up in town, we can just swap the pads over and go. But there's a whole list online of FDA-approved AEDs. Right? So step one is what? Turn it on. And then you get used to hearing the beeps because there's a lot of them.
Apply pads to patient's bare chest. Plug in the connector next to flashing light.
The first thing is apply the pads. There's a picture on each side that says roughly where they're supposed to go. One of them goes up here, and one of them goes down here, and it tells you specifically which one is which. So this AED is going to get a little annoyed with me if I don't do it fast enough, but I'm going to start to put the pads on, and it's going to keep repeating that question.
Apply pads, plug in connector.
So this AED requires the pads to be plugged in manually. Most new ones, the pads are already connected when you open it. So that might be different, but again, important to make sure that you follow the instructions specific to the AED that you're
Apply
using.
pads, insert connector, analyzing heart rhythm. Do not touch the patient.
Right? Do not touch, so we're not touching.
Shock advised.
So it's telling me that it is advising that I shock, but I have to wait until it
Charging.
tells me.
Stay clear of patient.
We're still clear. See how antsy it gets? It's making sure that
Deliver
we're clear.
shock now.
Make
Press
sure
the
before you
orange
push this button.
now.
What should we do again? Don't touch. Everybody clear. I'm clear. You're clear. Shocking.
Shock delivered.
Now what should we do?
Begin CPR.
We go right back to compressions. And we're going to do this for 2 minutes. We're going to do our 30 to 2, 30 compressions, 2 breaths, back and forth until the AED tells us to reanalyze or until help arrives. Question? Excellent. You guys remember staying alive? That's the beat to staying alive. So if you don't happen to have a speaker and a phone to play music with you when this happens, the AED will beep and tell you the approximate pace that you should be doing compressions. So if I do compressions in line with that beep, that's the appropriate rate for chest compressions. You will also have your guardian angel still on the phone that's going to be able to tell you and help you with that. Make sense? Question in the back.
Do you then put the EKG leads on, and are you waiting for readings?
So the question is, after you have performed CPR and used the AED, do we then put EKG leads on our patient and interpret that? We in the fire department as paramedics, yes, we do. So once we do CPR on somebody, we put them on the pads, but we also put them on the 4 lead so we can check what rhythm they're in. After that, let's say we do get ROSC, which is return of spontaneous circulation. That's a good thing. Once we get ROSC, we will do a 12-lead EKG, and what we're looking for is signs of that acute coronary syndrome that we talked about. So if we find those, then we might bring them to a different hospital. So that's one of the things we look for because it is one of the more common causes of cardiac arrest. We'll put the EKG leads on, we'll take a picture of the heart, and we'll determine the rhythm and if there are any indicators of acute coronary syndrome present on their EKG. Does that answer your question? Good. Any other questions? Yes? No, well, the pads, yes. The EKG, no, or the AED, no. So these can be recharged, the batteries can be replaced, you can get a new set of pads, and you can just put it right back in service. Yep. Any other questions? Yes?
If you were in a multiple situation and you didn't have another one of those, could you take them off and use them on another person?
These are always my favorite questions, right? So this is tricky. Typically for you guys, if you're in a situation and you have one patient, treat one patient. Unfortunately, we talk about mass casualty incidents in the fire service where patients outnumber resources. If you are one person and you have 2 victims, you're outnumbered. You can only treat one person, so treat that one person and treat them the best you can with what you have. Right? Couple things with the AED that we want to watch out for that are fairly common. Water. AED should not be used with a patient who is in water. So if they're in the water, if they're submerged in water, we need to get them out of it, and we need to wipe them off quickly. They do not need to be perfectly dry, but people might be sweaty, so you do want to give a quick wipe. Chest hair. Chest hair needs to be removed in order for the pads to get good contact if it's thick enough. Most AED kits will have razors in there that you can quickly shave where the pads are supposed to go and put the pads on. If there is too much chest hair, you will get a message from the AED that says, check pads. It means there's no good pad contact. You'll have to check and make sure you can try and get it a little bit better. Does that make sense? Any other questions? All right, we got one more thing to cover, and then I'll get to turn you loose. Am I behind schedule? All right. Big thing with CPR for you guys. 3 things that are going to make you stop. They wake up and they say stop. That's number 1. We show up and we take over. That's number 2. Or you're unable to continue, whether from physical exhaustion or you just can't do it anymore. That's number 3. So those are the times that once you start CPR, you would stop. So this leads us to bleeding control. And this is going to be the tourniquet part of our presentation. Bleeding is the number 1 cause of preventable death after trauma. Regardless of what the injury cause is or what the outcome is, bleeding, if we don't fix it, can cause serious negative outcome. So I'm going to pass 3 of these around just so you guys can see them while I talk about them. These are tourniquets. And the purpose of a tourniquet is to stop bleeding. There's some data that has been shown that has shown that bleeding control early can save a lot of lives. A lot of this data came from the military in studies, and it has been brought to the civilian world and has been used very effectively. There was a study that found that 96% of patients survived when a tourniquet was placed prior to the onset of shock versus the 4% that survived afterwards. They also showed that patients that are treated pre-hospitally with a tourniquet have an 89% survival rate versus 76 if that tourniquet's put on at the hospital. So that's a big number. And this is something that's very simple to use, but has a really, really good impact. First steps for the stop the bleed. Well, number one, we have to identify that this is more than just your run-of-the-mill cut or scrape. We look for the signs of life-threatening bleeding. Large volume of blood, pooling of blood, or continuous blood flow. Those are kind of three big ones that we look for. That if we see that, it's an indicator that this is serious, and if we don't stop it, it's going to have a bad outcome. Once we've identified it, then we need to stop it. Direct pressure or a tourniquet. Direct pressure is going to be good if you don't have anything else. You're just going to apply direct pressure to the area of the wound. Tourniquet is going to be great for the extremity. And we'll talk about a couple yeses and nos when it comes to tourniquet. So where does a tourniquet need to go? It needs to go on above the wound. So wherever the wound is, it has to go closer to the heart or above. We can't put it over joints. We obviously shouldn't put it around the neck, right? You might need more than one if one doesn't do the trick. Once they're on, they do not come off. If you put one on and the bleeding continues and you put another one on, do not take the first one off, just keep stacking. Does that make sense? So, Mark here has just sustained a significant injury to his arm. Right? So this is where we're going to use the tourniquet. Okay? There's a couple steps to a tourniquet that we want to make sure we know. Remember the basics. Above the wound, not over joints, not over here, that's bad. You may need to, and do not remove, okay? The tourniquets that you can see, they show up looped like this. We want to unstrap them. You can remove it from here if you want to. My recommendation is that you keep it like this because it's much easier to handle. Once the loop comes apart, imagine trying to put that back through here with your hand shaken. Not as easy to do. So, tourniquet goes above the wound. Let's say he's got a wound here in his nicely pressed shirt that I'm about to ruin. I want to go above that. 2 to 3 inches is a general rule as long as it's higher up. The first thing I'm going to do is I'm going to tighten it as tight as I possibly can without using the windlass. So just with the strap I have here, I'm going to tighten this to the best of my ability. This makes sure it takes out all the slack and gets as tight as possible before we turn it. The next step is going to be to twist this windlass. And you are going to twist this until the bleeding stops. Now, obviously, I'm not going to do that to Mark because this is incredibly painful, and we don't want to cause any damage, which we'll talk about. But I'm going to twist this until I see his wound stop bleeding. Once I twist it tight enough, I'm going to tuck it underneath this little plastic piece here. I'm going to take the extra. I'm going to secure it around this. And the last step is the time. I'm going to put this strap over the top, and I'm going to write the time of the application of this tourniquet. There is some science. There used to be a myth that if you put a tourniquet on somebody's limb, they would lose that limb. That is not the case. However, there is risk of permanent damage if this is left on for a significant amount of time. If this has successfully stopped the bleed, this is going to remain on the person until they get to definitive care, and possibly even longer. With that transport time, it can be over an hour, it can be 2 hours. So it's important for the surgeon, whoever is working on this patient down the road, to know when was that tourniquet put on, because they may need to relieve it if it's been too long before they operated, before they do what they need to do. Does that make sense? So we're going to go to our steps here again. First step of a tourniquet is we tighten it all the way. The second step is we twist that windlass until the bleeding stops. We tape or tuck that extra, and we write down the time. Any questions? Again, this is very basic overview of this. Tourniquets are fantastic. They're relatively affordable. If you do anything that puts you at risk of having significant injury, whether it's a hobby or a job or just general moving around the town, I encourage you to have one of these present, especially at home if you live alone or even if you live with somebody else. These are a really good resource to have, and as well as being familiar with how to use them. Any questions on tourniquets? Yes, ma'am. You can get them online. If you go to the Stop the Bleed website, they have a list of approved tourniquets. The important thing there is approved, because like most things, you will be able to find cheap knockoffs online for about half the price. However, they are cheap for a reason, and they have been shown to break when in use, which is obviously not great if you're trying to use a tourniquet to stop the bleed. So stopthebleed.com or .org has a list of approved tourniquets that you can use and then buy. Any other questions? Yes, sir. Mm-hmm.
Is there any use for the tourniquet?
Yeah, so the tourniquet only works on extremities. Any wounds to the torso or anywhere that's not an extremity is going to be direct pressure is going to be your best bet. Yep. Question in the back?
Available. I mean, are there things like a belt or a tie or something that you could use?
Yeah, good question. So the question is, if you don't have a tourniquet, what can you use? Yes, you can do improvised tourniquets. They are very difficult to do correctly, but much like compressions and CPR, it's better than nothing. So if you don't have an approved tourniquet to use and you have a belt or a shirt or something that you might be able to use, you can try. They're difficult to do correctly, but it is possible. So typically, direct pressure is going to be your best alternative to a tourniquet, unless you have training in improvised tourniquet. Any other questions? All right, that's all I have. Thank you guys very much for your time.
All right, that was great. Thank you. Next up, we have Mark Heller, who's going to be talking about emergency preparedness. But I'm going to invite you guys just to stretch your legs, run to the restroom if you need to, grab a drink, and we'll get started in 5 minutes. Sound good? Thank you. Started here in just about a minute.
Hello? Do I have to turn this on? No? Good. She's gonna.
So next up on in our public safety seminar schedule, we have Mark Keller. He's the Deputy Director of Emergency Management for the town of Chatham. So he's got a lot to tell you this morning. I am just going to let you guys know, it sounds like we're having a little bit of trouble hearing the questions. So if you guys do have a question, I'm going to come around with the microphone so that everyone can hear you. So it just might take me a second to make my way to you, but I think that will make it everyone's life a little bit easier. So thank you guys, and I'm turning it over to Mark.
How's everybody doing? Who's from out of town? No. So I'm going to talk about emergency management and being prepared. And our job at emergency management is to take any situation and imagine the worst and what could happen, and then we try to plan for it. So we'll talk about some of the things, and there's a lot of things specifically we're going to talk about today that you can do to be prepared for things. So as we go along, these are some of the agencies we work with, and I'm sure you've heard of them. FEMA, MEMA. FEMA, they come in when there's big disasters, things like that, and they're the support. There's the financial support eventually for recovery, but they get a lot of resources in place and for us to recover from the situation. Same with MEMA. There are a lot of our resources as well. If big things happen, I mean, we're a small community. We try to be prepared as much as we can, but we're only going to be so prepared because we only have so many assets for our town. So we work with these folks, and we have systems in place that things can come in and help us out. So we'll talk about that as well. So in the emergency management world, we look at preparedness, response, and recovery. Okay, those are our phases. We always look at things that way. Okay, and you can do a lot in preparedness. So we think of our beautiful Chatham, just like this. This is the way we like to think of it. You know, it's its own little Disney village. It's gorgeous. It's great. But bad things happen. We get bad storms. We get hurricanes. We get nor'easters. We get a lot of flooding. And it's bad, and things can happen, and we can lose a lot of property, we can lose infrastructure, things like that. And for a few days at a time, life can really be pretty crummy, okay? And we have to work around that. There's our flooding. Trees come down all the time. You know, we live 30 miles out at sea in a little strip of land, so things can happen, okay? We've all seen this stuff over the years. You know, fortunately, we've kind of dodged the bullet in the last few years, but they say this year's going to be quite a busy hurricane season. So we have to be prepared. That's one of the things we'll talk about. Okay? We have our barrier islands. They break apart. That's just part of nature. They protect us a lot, but then when they break apart, we have increased flooding and things like that. And then we have buildings collapsing left and right. Whoever thought we'd have to worry about tornadoes? A few years ago, we had a tornado come through here. So we have to think about these things. And that's our job, is to think about all this stuff. And then when you see this guy coming to pay you a visit, what does that mean? That's bad. You do not want to be on TV like that, right? We know that's bad. So remember, this is the most important thing. After the immediate threat has passed, your level of preparedness will determine your quality of life for the weeks and months to come. Okay? So the more you're prepared, when things go bad, you'll be able to sustain yourself and things will be a lot better off. Okay? And we'll talk about that. All right? We have to think ahead. Think about what's happened in the past. What has happened to us here in Chatham in the past? We've had storms. What do storms bring us? We lose power, okay? When we lose power, we lose internet, we lose heating, we lose air conditioning, we lose all that stuff, communication, okay? So it's a problem. And then what can we do to get through the next two phases, all right? And we can do a lot. That's what we're going to talk about, okay? Being prepared involves staying informed. So how can we do that? Know if you're in a flood zone, all right? Anybody ever been on the Barnstable County website? Good. On the Barnstable County website, there are flood maps. And there are all sorts of different flood maps. And they tell you if you're in a flood zone, the probability, not only the probability during a storm, but over the next 20 years, if your house is still going to be there, that kind of thing. So there's a lot of information out there, okay? Hurricane evacuation zone, pretty much that's dependent on the hurricane, but yeah. And what's our evacuation zone, or evacuation route here on Cape Cod? Route 6, which we can't get off of in the summer anyway. So odds are we're probably staying here, but let's talk about it, okay? This is something a lot of people disregard now because we're not as used to, pardon the pun, tuning into our local AM/FM radio like we used to. That was our lifeline, and we would get a lot of things that way. They have a lot of up-to-minute things going on, and they let us know, okay? We rely on our text messages, our social media, and things like that, and sometimes that's not as up-to-date. We try to keep it that way, and we have things to do with our communications in town, but sometimes the best way is just to listen to local radio. They know what's going on, okay? You can subscribe to local news apps. They give you updates all the time. It's great. I can get a notification in the middle of the night that it's going to start to rain in 4 minutes on my phone. That's really good to know, but I'm, sleeping, I'm okay. What's really fun is I go somewhere else. I go visit my son in Indiana, and I open up the weather app there, and then for 2 weeks when I come home, I'm still getting the, hey, it's going to rain 15 minutes in Indiana, So, but it's good to have this stuff and know how to use it on your phone, because your phone is pretty much your link to a lot of things now. Who here doesn't have a cell phone? Okay, good. All right, so everybody's tuned into that, and there's a million different cell phones, and I don't work for any of them, but there's many different things we can do there. But again, just the local news app, they'll give you a lot of information, okay? And the reverse 911, who here subscribes to our town reverse 911? Okay. Sarah's going to talk about it more, Lieutenant Harris, a little later, other programs as well. The reverse 911 is where something big's going to happen, and we know about it, or something's happening, and then we call you. You give us your phone number, and we call you to say, hey, it's us, it's the town. We want to let you know this is what's going on. Especially when there's big storms, say snowstorms. Hey, it's going to be bad. We're letting you know now. This is going to be bad. Prepare to lose power, but we're calling you that way. But you have to subscribe to that, all right? On our end, excuse me, we also don't want to put out every little thing to bother everybody, because I'm part of a text group that guys talk all the time, and I'm like, I have to turn them off. It's for emergencies, but it's hugely important. So I encourage you, if you are not subscribed to that, to do that, okay? And your phone. I happen to have an Apple phone. There's the Apple, the Androids, and maybe some others. But on those phones, there's alerts. There's Amber Alerts. There's Silver Alerts. There's Hurricane Alerts. There's Tornado Alerts. And they happen seldom, thank goodness. But have you ever had your phone go off? It's nasty. It like screams at you. It's like, watching a bad movie. The world's coming to an end. But it's helpful. When you get that, you really take notice, like, uh-oh, maybe I should pay attention here. So, but you have to make sure that's turned on. So that's a good thing too. And that's all free. That you shouldn't have to pay any more for that or anything like that, okay? But make sure your phone's set up for that. Some of you folks, anybody here, and you don't have to put your hands up, on the special assistance list or the reassurance list. Those are lists that Sarah's going to talk about more later that can help you if you have special needs or special situations, and that's a good way of keeping in the loop and knowing what's going on. And just keep that in mind later when she talks about that, okay? So you want to have an emergency plan. It sounds silly sometimes, and you think, oh, what's going to happen? But you want to have a plan. You want to make a plan and build a kit and be informed, okay? Things to do. Have a list of contacts, okay? Now, most of my contacts are in my phone. That's good, okay? So I know that that's where they are. Realize, though, that when cell service goes down, I'm the only one that's going to have that list, okay? We just have to know those limitations, all right? But that's my contact list. Do you have it set up in your phone where you have an emergency contact? Okay? Do you have it set up in your phone where when the fire department comes, the police department comes, that they can access your medical history right away? There's ways to do that. And there is your emergency contact and stuff. So that's just a simple way of doing it. But you want to have that stuff available. And for us, who to contact in case you have an emergency, all right? You want to establish a meeting location, all right? Even if you live by yourself and you have friends, you want to pick a spot and say, look, if something happens, we're going to meet here, okay, at this time, whatever it might be. But your family members, things like that, have an agreed upon spot, all right? Quick story. Okay, I've been in this kind of business my whole life. So when our kids were small, we did fire drills in our house. And our son, he was only 3 or something like that. So I made him crawl, put the blindfolds on him, stuff like that. And said, you have to meet at the front at the tree. Okay, little guy, okay. Well, are you coming? We'll be there. Don't wait for us, okay. What if I have to poop? You go right ahead, son. Don't worry about it. That was his concern. Not that the house was burning down, but don't worry about it. It's okay, yeah? But have a meeting location. It's good to do, all right? Have a plan for sheltering in place. Sheltering in place means that it's going to get bad, but you're going to stay put, okay? You're going to stay in your house. And when you think about that, whether it's going to be this way or not, think you're going to be there for 72 hours. That's kind of the benchmark of what you should plan for, okay? Long time, but think about that, all right? So you want to do all this other stuff. You want to make sure your house is secured so stuff doesn't start flying in, all right? You're not going to leave your windows open, all that other stuff, all right? But that's what you want to do. Radios. Make sure you have your radios ready and they're charged. Make sure you have a commercial radio that you can listen to FM, AM, that kind of stuff, all right? Because all that stuff's going to happen through those channels as well. Extra batteries. We're so used to having everything charged for us all the time and ready to go. When we don't have power, we have to have backup. So we want to make sure we have batteries, okay? Make sure you have rechargeable items that are charged to start with and maybe a way to recharge them. You can buy these charging banks online. They're not super expensive, and they're helpful for things like this, and they'll get you through a few days. My wife has one. It's solar powered. It charges all the time, so she's good to go for a while, okay? Think about food. Do you have enough food for 72 hours, okay? What's the first thing when we hear snow? I got to go to the market and get bread and milk, okay? I really don't drink milk, but I have to have bread. But still, you have to go to get enough food for whatever you're going to have. Think of it for 72 hours. Water as well. If the water gets contaminated, you're going to have you want to have fresh water for yourself, okay? If you have a pump, your pump's not going to work if there's no electricity, so you're not going to have water, okay? If you're getting connected to the sewer and you have one of those pumps, and I'm not on top of my sewer game here, so bear with me, but one of those maceration pumps or whatever, that's not going to work because it's electric, okay? So you might not even be able to flush the toilet. So things like that. You want to make sure you have water, okay? Your medicines and your medical supplies. Make sure you have enough for 72 hours, okay? Maybe it's calling the pharmacy saying, look, we're expected a storm. I'm running out tomorrow. Can I get it to you to get me through? They'll do it. They'll do it. And medical supplies. If you're on oxygen or whatever it might be, you have to think of those things. Fuel. You want to fill up your car beforehand because you don't know how long the recovery process is going to be, okay? We don't know how long we're going to be without electricity. So you have to think about that. And extra fuel for alternative power, all right? If you have alternative power for heating or cooling, you want to make sure you have fuel for that. Make sure it's properly vented, okay? And don't run generators inside. Because unfortunately, a lot of people do that and they don't think and like, oh, I have a heater, a propane heater. Well, it's creating tons of carbon monoxide and you're going to die, okay? Same with generators. Make sure everything's well vented, it's outside, and you're safe to go, okay? So these are the things you have to think of, all right? Make sure your home is secured, okay? Make sure it's all good. The windows are good, doors are closed tight, okay? Make sure your cars are in the garage if possible so things don't fall on them, all right? You don't have that extra damage. Know when to evacuate. Know the difference between evacuation warnings and evacuation orders. Evacuation warning means it's probably a good idea to go because based on our information, it's not going to be good. Does anybody live down by the little beach area, Morris Island area? Okay, that we know that floods when it's high tide and certain storms. There's probably a good time that you need to figure out either you're going to stay or you're going to go because you know that area is bad, okay? Oh, okay. Well, there's the silver lining to every dark cloud, right? There you go. But heed these warnings to say, hey, this is what's going on. Because on our end, we're using all of our outside resources. MEMA is on top of things. They have their own meteorologist. The county has their own meteorologist. They look at these things all the time. They look at flood and tides all the time. So they're on top of this to say, there's a good chance this is going to happen. Opposed to an evacuation order, that means you got to go. It's a lawful order to say, it's not going to be safe here, and we're telling you you have to go. Plain and simple. Then you have to go. So you have to be ready. So you want to be ready for these things. There's things you can do. Okay. Have your emergency kit. Include all your medical supplies. Again, use the benchmark 72 hours. Wherever you're going to go, and we'll talk about where you're going to go, you want to make sure you have everything you need. Your personal care items, whatever that might be. Okay? Your cell phone and chargers. All right? In really bad emergencies, the county and the state can come down and set up temporary cell sites so we can have service, okay? So the rest of the system might be down, but we might be able to work in a small area. So at least you can contact people, get information out, things like that. Again, a list of your contacts, people you're going to need to talk to, all right? What happens if it's more than 72 hours and you need more prescription medication? You need your doctor's contact. You need their pharmacy contact. You need whoever it might be, okay? What about your pets? Who has pets? Yeah, what about our pets? My little dog Ted, he's coming with me. He's priority, okay? We got to make sure he has enough food and his stuff, okay? And this is what people don't think a lot about, and we're going to talk about this more later, or important documents, okay? You want to bring those with you because you're going to need them in case things get bad. And again, remember, from my perspective is the sky is falling, and this is the worst day ever. So we'll talk about that, okay? And food and water. If you go somewhere to a regional shelter, there will have these provisions. But if you wind up going to a friend's house that's in a safer place, they still might be without some of these things. So you have to plan ahead and think of that, okay? Listen and heed the warnings. If you're told to leave, leave. Leave. It's not being mean, and it's not trying to, scare you or anything. It's for your own safety, okay? There's the old joke. It's a flood, okay? So here comes the flood, and guy comes, I'm going to stay in my house. The Lord will take care of me. And this is not a religious joke. Just bear with me. So the Lord will take care of me. A boat comes by. Come on, get in. We'll save you. We'll save you. No, the Lord will take care of me. Okay. Now it's a bigger flood. Now this bigger boat comes by. Come on. The flood is coming. You're going to die. The Lord will take care of me. Don't worry about me. I'm good. Now the guy's on his roof. Okay. The helicopter comes. All right. Come on, this is your last chance. You're going to die. The Lord will take care of me. Well, guess what happens? The guy dies. He goes to heaven. He goes, God, what happened? He goes, I sent you 2 boats and a helicopter. What's the matter with you? It's like, listen to the warning. Listen to the message. Okay, when they say to go, go. All right? You have to do that. Know your options where to go. So this is important. So do you know the difference between a warming center and a regional shelter? When it gets cold and gets nasty, we can gather here. And what is this building? Our community center. But this is a warming center, a personal care center. It means we can come here for a little while, get warm if it's freezing out, come here and get cool if it's not, if it's 90,000 degrees outside. We can charge our phones, etc. We can prepare ourselves something to eat, and then we can go home, okay? It's not an overnight stay, all right? There are laws that govern how all this stuff is set up, and this building doesn't meet all those requirements. We're not capable of providing an overnight shelter in town. That's why we gather with other communities and regionally pool our resources into a regional shelter. Our regional shelter is the Monomoy Tech School, okay? And we go over there. That's the regional shelter. So we want to know the difference. Maybe your church has provisions. Some churches have generators. Some churches do this for their parishioners. Hey, you can come here. We have food, we have a kitchen, we prepare for these things. Know if that's an option for you. If it is, it's probably a good option. You're with people you know. You're with people who have your back. They have food for you. They have all that stuff. So, listen again. Once again, I'm repeating myself. Listen to local information. Find out what's going on. Call and find out before you lose communication. Call your church. Hey, is the church going to be open? Oh, no. Call the town. The town is going to do its best to get that information out to you about, hey, the warming center is going to be open. The warming center is not going to be open. The regional shelter is going to be open. This is how you can get there, things like that. Know how you'll get there, whether you're going to take your personal vehicle or you need transportation. And again, the town sets that up. Anna talked about that before. There's the provision, so we can get you there and we'll get you back, okay? If you don't have a vehicle or if you don't feel safe or it's just that bad out, we don't want you driving your car, okay? We'll get you there. That's not a problem at all right? Then we talk about recovery. So now the event's over, all right? But you were prepared, so you're all set. You can make it through your 72 hours. Safety first, okay? Listen to the authorities. Don't go back into an area that's not safe. There's wires down, there's trees down, there's all sorts of bad stuff going on. You don't want to hurt yourself, okay? If I went home after a big storm and I saw, you know, some big branch laying on my house, my first thing would be try to move the branch so the house doesn't get, I can't move branches anymore. I'm not doing that. So you have to be careful, okay? Beware of road closures, down wires, and lack of utilities. Remember, just because the storm's over doesn't mean it's hunky-dory to go back home, all right? Assess your home. See if there's damage, okay? Look at the outside first. Hey, what happened here? Am I losing a window? Is it tree through the roof? Whatever it could be, all right? Standing water's bad. You never want to walk through standing water because you never know if there's a bottom to it, okay? That's why when streets are flooded, the the current can actually lift up manhole covers, and you're walking along and you're thinking you're fine, and then boom, you're underground somewhere. Not good. All right, you trip on debris, it's not good, all that stuff. Don't attempt to move anything beyond your capabilities, all right? Leave it in place, okay? If it's safe, you can enter your home. If the power's still out, turn off your main breaker if you haven't done so, because when the power comes back on, it might not be an even regeneration, and it can ruin a lot of our electrical components and our electronics, okay? It's just a safer way of doing it, much safer way of doing it. Sure.
Do that. Or
You can, yes. It's a good idea. I happen to. I turn certain things off. You know, if I know I'm leaving, even if I go away on vacation, I usually turn my water off and I turn certain breakers off. Some I want on because I have my cameras and my, you know, remote control lights and things like that. But I always turn my water off because that could happen and I have a water, you know, and for 2 weeks my water's running in my basement and I come home to an indoor pool, you know, so things like that. So it's not a bad idea. Assess for water leaks. See if there's anything leaking, okay? Has any water entered your home? Through either the roof, the windows, the floor, has it seeped up? You never know. Because these storms and the storm surges are so much, maybe your house was intact, but now there's a crack somewhere, okay? Not good. Any pipes have been broken. We know that in the winter, especially for the seasonal folks. They turn everything off, they don't bleed their pipes. It gets really cold, their pipes burst when it gets warm, and now they have a water leak. So that's bad, okay? If any damage, where's the water coming from? Look for other structural problems with your windows, your doors, roof shingles, chimneys, vents, anything like that. Anything on the outside, okay? Because a lot of this stuff can blow away, and you really, if you're not paying attention to it because you're fixated on the branch that's blocking you from entering your house, you're not looking at all these other problems first. So, this is the great thing. Everybody here has a cell phone, and I'm assuming that the vast majority, if not all of you, have that camera in your cell phone. So you can start to document all these problems for your insurance company to make it as easy for you. So when even you, before you get back in your house, snap, here's a picture of my house with all this stuff going on. Here's a picture of the branch through the window. Okay, we're not going to wait the 2 months before the adjuster can come out and look at the window to say, yep, the branch came through the window. We'll fix it for you. No, you want to board that up, but you want to show them what it looked like beforehand. So you can go around and take pictures. It's nice and easy. Create a list. This is the outside. This is the inside. So easy. So easy. If you're home, you go to your home and it looks something like this, you can't stay there. Go back to the shelter. The shelter is not going to close automatically. Even if the shelter does at some point close and you can't return to your home, there are other means to get you shelter. All right, the Red Cross can get involved. There's other agencies that get involved. They'll find a place for you to live, okay? Alternative housing. You have family, local officials, the Red Cross, whatever it might be. and you want to contact your insurance company, let them know, hey, I went back to my house and it's barely there, okay? So so that's why it's important to have all those numbers in your contact list. So if you have to go back to the shelter now and start to get your life back together, you at least know who to call, okay? I think of those poor people a couple months ago in California during the fires, and they're leaving with a couple bags. You know, who knows what they have, but they have all that stuff. We're going to talk about that a little bit more too. Documents. These are the documents you want to take with you and make sure you have. Your driver's license, your passport, your birth certificate, okay? You never know what they're going to ask for, all right? When FEMA gets involved, if it's a disaster area, they get involved because then that's the money flow, okay? You're going to have to deal with them. They're going to need all this stuff, all right? It's going to be crazy. It's like when you apply for things, a credit card or something, they want to know your I don't know, first dog's name or whatever. But it's crazy stuff, all right? Marriage license. I don't know how many times for different documents they've wanted our marriage license. Okay, here you go. Your medical insurance. Make sure you have all your cards with you and your numbers. Make sure you have all that stuff with you. It's great. You can take pictures of this stuff and put it on your phone. Make a little file. This is my important stuff. Throw the cards on the table, take the picture. In the event you don't have the cards, at least you have the picture and you can prove that that's what it was and that's your number, okay? And all your supplement information too, all right? It's not just Medicare, it's not just this one, that one, all the supplements, whatever it might be. Your pet's information. Make sure you have your pet's information, the rabies vaccine, because depending on sometimes the shelter, they might want to see that your pet is vaccinated. No problem. Here it is, okay? And your chip ID information. What happens if your pet escapes? You want to make sure you have that information. So, because I won't speak for Sarah, who's here, but they deal with gathering up a lot of the lost pets. The first thing they do is scan them. Oh, this is Ted. He belongs to Mark Heller. Okay, here. So you want to have that information with you too. Your policy numbers. What's the first thing when you call your insurance company? What's your policy number? Okay, all right, I'm ready for you. I got it, all right? Homeowner's insurance, your agent's contact information, okay? Maybe credentials in the flood path and they got knocked out. Call your agent. You want to have all this stuff. Even if you don't need it, you have it. You don't have to worry about it. Policy numbers are huge. Supplemental insurance, we talked about. If you're in a flood zone and you have flood insurance, make sure you have that information, okay? Yes, sir. I don't know either. I don't know either. And I'm not going to get into politics, but I can tell you from our preparedness, there are not as many meteorologists already working for the National Weather Service, and our warnings for hurricane season are not going to be what they were. That is not a political statement, it's a fact. So our early warning system is not going to be what it was. All more reason that local people like myself and Justin Savano, who's the director, we have to stay on top of it a little bit more. So, policy numbers, we talked about that. Your bank information. Okay, if you're going to be away for a while, you want all your bank information, your numbers, your contact information. So what are they going to say? Okay, well, we're going to wire you your claim amount. Here's my bank number. Here you go. Don't have to worry about it. You don't have to worry about sending me a check because I'm not going home to get my mail. Okay, all done. This is a crazy one, but your property tax bill, it has your lot numbers and all that other stuff, and they're going to want that for insurance, especially if the FEMA people get involved. What's your lot number? I don't know. I live at 812. I don't know what beyond that, but that crazy information is only on that stuff. So you want that bill and that number. Same with all your utilities, your electric, your gas, your cable, all that stuff. Okay, have it with you. If you don't need it, bonus, but have it with you. Honestly, putting this all in one place, this is an hour of one afternoon. Taking some pictures, writing it down, and it's all in your phone. And fortunately, most of the stuff that's in our phone is backed up, and we don't have to worry about it. And it travels with us, and we have it everywhere. Okay, so it's a great thing to use. Very good. Tax bill, very important. Okay. In the event of emergency, the big funds come from these folks. Okay, and there's a whole process that goes on behind the scenes, which is part of our job, to make sure that we qualify for any type of federal reimbursement. Okay? There's a threshold, but that is one of our main goals is that we have all our procedures and paperwork in place in the event there's an emergency declared, so we're all set to go. So that's a big thing that we do. Other people that will help you, the Red Cross and us, we're here to help you prepare and recover. So if you have questions about preparing any of the things I talked about today, we're here to help you. We're here to help you with anything like that. Again, our job is to make sure that we have plans in place that if something happens and the sky's falling, we're ready to do as much as we can. So, any questions? Yes? You can contact me. There I am. There's my email. Yes, sir. Yes.
Is there a document? I've probably missed a bunch of things that you said.
Good point.
Is there a document that
So if
lists those
you
things?
go on the MEMA, which is the Massachusetts Emergency Management website, they have a lot of tools there for things like that. Your insurance companies might have things as well. They might have packets and things, toolkits like that. But I know MEMA has quite a few. FEMA has some too. There's a lot of things on the FEMA site where you think it's all just, after the fact and disaster and stuff. There's a lot of stuff that you can use beforehand that's very helpful. Yeah, absolutely. Absolutely. I don't have a specific list. I can put one together for you. Sure, you seem nice.
Thank you.
I can help you.
Maybe you had that, on hand.
I'd be happy to put it together. Sure.
Put what together?
Just a list of things that we talked about here. I can do that. I can do that. And if you want to email me, I'll put it together and I'll send it to you. Not a problem at all.
We recently got the blue envelope from the town that described all this material that you're doing. You do it in a little more detail.
That's one of the surveys, yes. There's going to be another survey coming around too about hazards and things like that, which is helpful to us to plan. Okay? Again, our goal is we want to be ready for you. We want to help you as much as we can. Okay? Any other questions?
I
Yes,
just
sir.
want to make one comment back on the wires, down wires.
Yes.
And I work for the town myself, I work for the DBW. And everybody would ask me if I was going to remove somebody's telephone wire. I said, I'm not touching that wire because even though that wire's down, you don't know up the road there's an electrical wire involved into that telephone wire where I might be fried chicken by the time I'm done.
Yeah.
And I don't ever touch any wire that is down that could be that you think, oh, I can just move that wire out of my
Absolutely.
wagon, out of my driveway. Don't assume
Absolutely.
that you can do that.
Do not take that chance. Call the fire department. We have equipment that we can test things like that. Yes, ma'am.
A video not too long ago about a wire down, and there's a field around it that is a danger area.
Absolutely.
That you don't, you shouldn't even get close to it.
Absolutely. So when the fire department goes and there's a down wire and we're not sure if it's live or not, there's an area that we'll rope away and tape off, if you will, to make sure that nobody goes there. Just for that reason, you don't know the voltage, you don't know, and I'm not an electrician. I know there's volts and amps, but you don't know how much juice is coming out of that thing, and it's going back into the ground. And you touch the ground and you're in bad shape, so you have to be careful.
Make a statement too. I used to work in a utility company too, and they definitely, if something falls on your car, don't get out of your car if
No.
there's an electric line around it, because as soon as you step out of that car, it will create an issue too.
Right. You
So
create
wait
the
until
ground.
somebody comes and tells you you're safe and it's been taken care of.
Absolutely.
Unless your car's on fire, then you have to make a choice.
Yeah, you're absolutely right. When there's something on your car, you don't want to get out. They always say, well, if you jump before, yeah, well, no.
I just wanted to say that if your basement is flooded and you come back to the house and you say, oh, I should turn off the power.
Oh, no, good point. Very good point. Do not go into standing water like that. No, not at all. Not at all. Very good point. I'm sorry if I didn't. No. Absolutely. That's another reason why you might want to turn it off before you leave, before the event, but you certainly don't want to go into standing water and mess around with anything electrical. Not at all. So that's a good point. Any other questions? Great. Oh, yeah.
You have a generator.
Yep.
What else? If your generator's on, should you stop it, or what do you do?
If it's automatically, if it's hardwired in, it's probably going to be automatic and come on and things like that, and just let it go. If it's a portable thing, personally, I would probably turn it off because I'm only going to have so much fuel before then it's just going to die at some point. So when I come back, I can at least have that going. But that's up to you. But, yes, ma'am.
A follow up with what she just said. If your generator is hardwired in and you turn your power on, your generator is going to turn on.
Yes.
So
As far as I know, but I'm not a generator guy. I don't know.
Main power, your generator will turn on.
I'm going to give you the stock answer.
Okay.
Contact your generator people. Because I don't know. I don't want to give you the wrong answer. I'm not a generator guy. I have really no experience in that. But it's a great question. I don't know.
But you would have
Yeah.
to go into the generating unit. And if you put the pop up there, you see it automatic, manual, and then in the middle section is an off switch.
I don't think I'm going to pop the top one, my generator.
I wouldn't start messing with it.
There is a way to.
But I don't think I can pop the top one, my generator.
Anything else? I'll be around at lunch if you have other questions for me. Thank you so much. I appreciate it. Be safe out there.
Thanks, Mark. That was great. Just so everyone knows, also, the format of all of our emails is our first initial last name at chatham-ma.gov. So if anyone has any questions specifically for presenters today, that's our email is all that same setup. So good to know. While Rachel is getting set up for fire prevention and safety, I just wanted to let you guys know that, and I'm sorry if I'm botching the name of your group, but the Chatham, there's a climate survey, the Climate Action Network. Great. The Chatham Energy and Climate Committee and the Climate Action Network have brought their surveys here. So we have hard copies as well as the QR codes. If anyone wants to go through that survey on their phone, they would very greatly appreciate your participation in that. So thank you guys for bringing those here. So like I said, next up is Rachel McGrath. She's going to be talking about fire prevention and fire safety. After her presentation, we will have lunch, and then we'll just keep going. So thank you guys all for your attention and your time. I really appreciate it.
I'll use
You want to pull that white side with all the words.
If you guys just bear with us, we have a little setup to do.
You need to see.
And then I have. Is that or do you want to? What's in it?
Thanks. Thank you. No, I think I'm good. Hi, everybody. I'm Rachel from the fire department. This is Steps to Safety. This is a National Fire Protection
Association presentation. It's a two-part series. The first one is about fire prevention, and we'll do that before lunch. Then we'll have some lunch, and the second part comes after, and that's about fall prevention. So I gave you a whole lot of paper. If we want to just go through that real quick. We're going to use these during the presentation, the first two pieces especially. These are the 8 steps I'm going to cover on fire prevention. That's the yellow. That's right on the top there. After that, later, we'll go over the 8 steps to fall prevention, the green one. During this presentation, we're going to talk about escape planning, which is the 3rd sheet. And this is the worksheet that goes with that. We'll go over all this stuff. Toward the back is the bright yellow one. That's a home fire safety survey. I do these for people in their homes. I'm not going to go over every single thing on this list, but you're welcome to look at it and generate questions, or we can talk about what's on there too. I do have a sign-up list if anybody wants to get on board with that, and we can send somebody out to look at the house and see what improvements can be made to get safer. And that clipboard is right over on the table with my oven mitts. And then the last page is an evaluation, and that's going to be for both parts of the talk I'm doing, just so I can make any improvements that you all think of. Okay? So let's get started. So the NFPA is our fire service science organization. They study all the data that comes from emergency events, and they come back to us and tell us what kinds of things that we can do better or work on as a community, sometimes as providers, etc. So I rely on NFPA for some statistics, which you can see on the whiteboard over here. These are 3 main causes of fires that you can read about. I hope everybody can see it, or you can come up during the break and see that there's a lot of fires happening, and they're not all terrible, but they do happen, and it's a good thing to talk about so we can prevent them and share with each other. So, like I said, we're going to talk about some fire and fall tips to keep you safe at home. We're going to learn and share with each other. Please feel free to ask questions at any time. That's why we're here to do. Just raise your hand and I'll bring the microphone over for you. So that's me. That's my contact information. I did put on 911 for emergencies in case anybody didn't know. I'm sure you all know that's the emergency call number. But we do have a business line if people have questions about anything or are looking for any sort of resource. We're here for you. And I'll have that at the end also, if anybody else wants to write it down then. So fire prevention. Has anybody had a fire? No fires. That's good. They're very rare. It's kind of a scary subject, but fires are so rare, and they do happen. So it's a good idea to prepare for them and prevent. And especially when we're talking amongst our friends and our families. I think with this group, it seems like I'm preaching to the choir a little bit. People probably know a lot of the stuff that I might cover here, but there might be something that triggers you to think about it a little bit, and maybe you want to share with somebody that you know who may not be aware of anything here. So fire, the big thing now is fire is fast. It's a very fast-moving thing. It's changed in the past 40 years. It's moving faster because of the way that we set up our homes. We like to have open floor plans. We like to have furnishings like you're seeing here. These types of furnishings, like the chairs and the rug, they're not made of organic kind of materials. They're synthetic materials, and that means they burn faster and hotter than things that we used to furnish our homes with. Smoke is a bad thing. It kills more people than fire does. So we can't deal with any kind of smoke. We have to avoid that just the way that we avoid fire. And that last point, we might have as little as 2 minutes to safely leave once the smoke alarm sounds. And of course, every time the smoke alarm sounds, we're going to get out of the building. The smoke alarm sounds here, we're going to get out. Make sense? So there's one of the furnishings like people used to have. Looks like it's made of wood, maybe some wool, but probably not the synthetic stuff that we see today. And that's a more modern furnishing. Those two things are going to behave differently in a fire. So we're not as safe as we used to be because fire is faster. And that last picture showing one of those open floor plans. It's a lovely place to hang out, but fire will move fast through there if it happens. And then we have some top causes. Cooking is a big cause of home fires. We'll get to the messages in a little bit that I have on the yellow sheet. Space heaters are a big cause. Smoking might be the biggest cause of home fires. Electrical fires happen. Candles cause fires, especially if they're unattended. So here's fire message number 1. This one you'll see on your yellow sheet. We're going to start going through those now. So smoking materials, I'm going to read from the whiteboard there, started an estimated 16,500 home structure fires reported in the U.S. in 2016. These fires caused 660 deaths, 1,060 injuries, and $372 million in property damage. So smoking is a big deal when it comes to home fires. And I'm not going to ask if people smoke. If they do, that's not something I'm going to argue with. That didn't work for us in the past and doesn't work now. So what we say is if you smoke, smoke outside. If you know somebody who smokes, ask them to please smoke outside. There's certain ashtrays that are better than others. Deep and sturdy ones, you don't want it to be able to get kicked over or anything like that. Cigarettes that aren't going into ashtrays, they need to get wet down before you throw them out. We don't want to just kind of knock off the end there. They need to be wet down with water. Never smoke in bed. That's happening with a lot of the fires being reported, sadly. Never smoke if medical oxygen is in the home. So oxygen is an explosive gas. If there's any kind of flame, even a teeny tiny one from the end of a cigarette, that can cause an oxygen piece of equipment to explode. And it causes horrible injuries and it causes building fires. So that's why we're seeing it here. Candles, we can't leave those unattended. We need to keep anything that's near them at least a foot away. But most importantly, smoking happening outside anytime it's happening. Fire message number 2, give space heaters space. Maybe that's why they call them space heaters, because they need some space. They need 3 feet of space, these things, wherever you might have them in your home. There should be 3 feet of clearance between that space heater and anything else in the room, including the people. We want to shut them off and unplug them if we leave the room or if we go to bed. And space heaters need to be plugged directly into an outlet. Extension cords are not made for things like space heaters, and if they always come with a tag. I don't usually read the tag, but on the tag it says to plug them directly into an outlet because it's a heating appliance similar to the things that are in your kitchen. They need to go directly into outlets and not on extension cords or smart strips. What are some items that might be left too close to a space heater? Any ideas? Mm-hmm. Furniture, curtains, yep, very good. Okay, fire message number 3. Stay in the kitchen when frying food and cooking on the stovetop. So cooking needs to be attended. I'm like everybody else. I'll walk away when I'm in the kitchen, and I might come back to find something that I wasn't expecting. I brought my frying pan from home because there's a way to avoid this. And it's about little reminders. So maybe I have a little something in the kitchen that I can carry with me if I need to go in the other room. Maybe I have a timer that will ring a bell to remind me to come back. So if I leave the room, say I go into the living room or I go to answer the phone somewhere, and then I do that thing, I look down and I've got this jar opener in my hand, and I think, why is that in my hand? Oh, I need to be in the kitchen where I was just cooking. So we're not leaving the cooking unattended for too long. Wear short or form-fitting sleeves when cooking. I brought some loose clothing to demonstrate how not to be cooking. If I can find how this goes. So this has some loose material, loose sleeves, and say I have this pan here and I'm cooking, and if it catches fire, who's next? This, my face, everything. So this would not be the right thing to be cooking in. Looks really nice, but we're not going to be cooking in that. I think everything that people are wearing in here today, including myself, would be appropriate for cooking, would you say? Safe enough? Oh, and cooking on the whiteboard, there's a nice statistic there. Not a happy one, but cooking is the leading cause of reported home fires and home fire injuries in the years 2015 to 2019. And the second leading cause of home fire deaths. Unattended cooking leads the reasons for cooking fires. Another great thing from the NFPA. Use oven mitts to handle hot pans. I'm sure you do already. I've got some nice oven mitts with a safety message. They're on the table back here. Please take one or two if you want. We don't want to burn our hands, of course. And if a burn happens and you know how to do the first aid on it, go for it. If you need any help with that, give us a call. If you're not sure, we'll come and help you with that, okay? But a lot of burns need to be seen by a doctor, pretty much all of them. Keep a lid nearby. If a pan of food catches fire, slide a lid over it and turn off the burner. So here's my good old frying pan. And say we had a fire in it. I have my lid handy already because I'm prepared for this. I'm just going to slide it right over. And then I know that the oxygen is taken away and that fire is going to go out, and I don't need to worry about it. I'm not spraying it with anything. I'm not throwing a blanket on it. I'm just going to slide a lid over because that's easy. And I had my lid there in the first place. Any questions about that? Okay. And then obviously, we know this. Don't cook if you're drowsy from alcohol or medication. Just not a good idea. We know that. What are some ways that you keep yourself safe when you're cooking?
Don't necessarily eat it.
Okay. You don't necessarily eat it. Okay. That could be safer.
You don't necessarily eat it. Somebody else do.
You use your microwave. That's a good idea too. So we do get that question a lot, and what I say is they're effective for certain situations and certain people. I would say they're not universally perfect. It might be something that people keep in the house if they think they might want to use it, but we do run a risk of getting too close to fires when we use those. We might, if we apply it wrong, we can actually fan the fire and make it worse or spread. So it's something that needs to be used in a very careful way. So one of the tools, but not for every piece of work. Okay? Fire message number 4. If you catch on fire, stop, drop, and roll. We've been teaching this to kids for decades. Now we're teaching it to adults because now it's the adults that are getting hurt in fires more than the kids. So there's safe ways to do this, but there is a chance that you might get a bruise or something, but that's better than getting a burn, I would say. So the technique is to, if your clothes catch on fire, you're going to stop what you're doing because you can't run from it. Drop gently to the ground. Cover your face with your hands. Keep that fire off of it. Roll over and over, back and forth until the fire is out. Similar to the lid on the pan, when you take that air away from the fire by smothering it with the weight of your body, it'll go out. You might have to roll a lot of times, but it does work. And then, of course, getting medical help right away is key. And why do we know that this technique works? What is it that makes it work? Yep. Yep. Good, yes. So we're taking the oxygen away, and that's why it works. A blanket can burn. Are you asking about the fire blankets? Yep, so you're right about that. But if applied correctly, it can also smother flames. And it depends also what material the blanket is made of. So if you had like a... Yep, but if that's all that you have, it's better than nothing. So if it was like a wool blanket or a cotton blanket or a wet towel perhaps, that would work better than, say, a synthetic material one. But if all you have is a synthetic one, use that. Okay? But that's a good question, thank you. Fire message number 5, smoke and carbon monoxide alarms save lives. We know that when people have fires and they don't have these alarms, they're not getting out of the house as often or sometimes not quick enough. So when the fire senses smoke, it goes off and we need to get out of the house. And we'll talk about escape plans with this too. But first, we want to install smoke alarms on every level of the home. They need to be in each bedroom and outside each sleeping area. This is the ideal situation. It's not the code for every single person's house in case they're selling it or purchasing a house. There might be some variations there. But if you want to have the best protection, that is the way. In each bedroom, on every level, and outside each sleeping area. Interconnected alarms are a great option. When one sounds, they all sound. So that means if you are in a different part of the house than where the fire is, you can hear the alarm that happens to be in the place that you are because it's already talked to the one that has gone off from smoke. Carbon monoxide alarms belong on each level of your home. Carbon monoxide is a very toxic gas. It is odorless and colorless. And the only way to really know if it's in the air is if the CO alarm goes off. So it's essential to have one of those on each level of your home. And I do have alarms that people can check out over here on my table. There's one CO alarm, and then there's one smoke alarm. And so they also need to be maintained. You want to check your smoke and CO alarms once a month by pressing the little button on it, or have somebody do that for you. And that way you know it's going to work if you need it to work. The other thing is everybody in the house needs to be able to hear smoke or CO alarms any time of day or night. So if people are wearing hearing aids, oftentimes they're taking them off at night. They might need a different type of alarm system. We do have systems available, not at the fire department, but we can help you obtain them if you're interested. There are systems for deaf people, and they include strobes, they include bed shakers, and they include super loud sounding machines that will listen to existing detectors and provide more stimulus to get the point across that it's time to get out. And I do have some of those on the table also for show and tell. If anybody wants to see those. If anybody wants to get some, we can help you with that too if you call the fire department. Has anybody tested their alarms at home? Yes, over here? Yep. Good. What strategy do you use? Do you have something reminding you in the calendar, or? Just, yeah, when you think of it. That works. Good. Thank you. Yes.
I'm aware that the law requires that smoke detectors be outside. I'm aware that the law requires that the smoke detectors be located outside the bedrooms.
Mm-hmm.
Does it also require that they be in each bedroom?
That idea is the ideal, and that's what we are requiring for new homes and resales. But if you have a home and you don't have alarms in every place like that, that is not against the law. That is your choice. So you can have all these alarms, or you can have what you have right now, and that is almost as good. Okay?
For a sale, it
For a sale,
requires that
yeah.
they be in the bedroom and outside the sleeping quarters.
Depending on the date that your house was built or renovated, there might be a slightly different code. Yeah.
Thank you.
You're welcome.
Just to go on his question, in the bedroom, is a battery-operated alarm okay, or do they have to be hardwired now?
Battery operated is okay. Hardwired is what they're recommending as the top standard. The hardwired works great. They all have a battery backup. That way, if the power goes out, then the battery will take over and alert you if there's a fire. So both is great. Of course, in this case, more is better. So if you have more alarms, that's better. If you have more types of power going to your alarm, that's better. But a battery-operated one is better than no alarm. In the back, please.
I was great about changing the batteries in smoke detectors, but I discovered a few years ago that I was putting new batteries into smoke detectors that themselves had expired 3 years before.
Yes.
The smoke detector is good for what, 10 years?
7 to 10 years.
And it's not obvious. You have to kind of take the thing off and look at the bottom of it to see when it expires.
Yeah, it's very fine print.
And finer each year for some reason.
Right. And then anybody who is replacing their 1 or 2 alarms, we always recommend that they replace the whole system at once. And that way you're not wondering, was this one, did I put that in 2018 or did I put that in 2024? You know when they all started if they all went up at the same time, even though it could be expensive. That's the gold standard too.
I had a carbon monoxide detector that was periodically beeping, and I replaced the battery, periodically beeping. Finally, I took it out of the wall and read the back, and it said if it had a certain kind of beep, number came up, it meant it was dead.
Yes.
So,
They will tell you things.
so this thing was telling me, hey, I just kicked a bucket,
Yes.
replace me.
Right. And that's the very fine print. I'm surprised you found that. That's the very fine print. That type is so small I have to put on my glasses. But they do, a lot of them will tell you what their beeping means, and you have to listen very carefully. 5 beeps mean this, or 2 short beeps, and then a pause, and then 2 more beeps, and then a pause. That might mean this. And they're different between the detectors. So yes, we do come to people's houses when their alarms make different sounds, and we help people through that. We're happy to do it. We also will change batteries for people, because we don't all go on ladders. We all do, but not the community necessarily. So, and one more thing about detectors is they like to be maintained, not just tested, but we suggest that people will vacuum them out periodically, maybe once per season or once every couple of months, whenever you feel like it. If you have a wand on your vacuum and you can stick it up there and just kind of give it a little dusting, the dust can set off alarms and cause what we call nuisance alarms, because they're a nuisance to people, and they will actually, people will take down their alarms just to, stop having that nuisance. But you can prevent that by giving it a little vacuum right around the edge. You can see on an alarm it's open on the edges a little bit, and you can take that dust out so that it doesn't cause an alarm which is unfounded. Any questions about that? Pam?
Of the house, would that include the basement too?
Yes. Yep. Mainly living spaces, but the basement too. She's asking if using a CO alarm on every level of the house, does that include the basement? So yes, it does. Yes, it does include the basement. Or any places where people are inhabiting. Some people have attics that are renovated, and you throw a couple of beds up there and have your guests come down for the weekend. There should probably be a CO and a smoke alarm in that room also, wherever people are. But not an attic that's like used for storage. That's not necessary. But an attic that is used for a bedroom, that it happens. Especially on the Cape. We have friends and family coming down for the weekend. We might throw a couple beds together. They should have the protection of an alarm in that space. And you can get a combination one that detects CO and smoke. Okay? Anything else on the message number 5?
I have a question about carbon monoxide alarms.
Okay.
There were a couple of things in the newspaper in the last couple of months. Is it possible to get a travel carbon monoxide detector?
Oh, yes. Yes.
Where does one find these?
I would say the internet.
Okay.
If you know somebody that goes online and shops for things, I would say, can you please get me a travel CO alarm? I think they're like $25 maybe at the most. You can attach it to your luggage if you want to, but it's definitely not a bad idea.
Yeah.
Okay. And then this is the bed shaker and the strobe alarms that I talked about for the hearing impaired, or those who don't wear their hearing aids to bed, because why would you? Fire message number 6, plan and practice your escape from fire. You want to have 2 ways out of every room, 2 ways out of the home, 2 ways out of really anywhere you are. We have 2 ways out of this room. We got several ways. That door, this door, that door. The windows, we don't like those as much, but we do have 2 ways out of here, right? Windows and doors, they need to be opened easily. So test your windows. If there's a child in a bedroom, they need to be able to open the window, just in case. 2 ways out. And of course, if the alarm sounds, we get out and stay out. So that's where you have your worksheet. That's your homework. And you can make your own home escape plan with anybody that you live with or that you know. You just make a basic sketch. I have one here that you can see. It's completed. Basic lines for walls. Somebody wrote bedroom, bathroom, and then arrows for here's where I would get out. So not complicated, but it's good to have a plan and then you don't have to think about it. I think we're getting towards lunch, so I'm going to try to speed up a tiny bit. What if you can't get out? So there's things that you can do. Of course, call 911 and get us moving. We can get you out. But in the meantime, you can shelter in place. Like it says on the back of hotel doors, you can stuff a wet towel under the jamb of the door. That does keep the smoke out for a very long time. And you can stay near a window and call 911. If you have any trouble with stairs, or you know somebody that has trouble with stairs, ask them if they can sleep on the first floor, because it'll just be easier to get out. This is a comparison between a room that has an open door versus a room that has a closed door and a fire. And you can tell on the right there, that would be the room that had an open door. Hopefully nobody was in there. But this door was shut, so there probably was someone in there, and they probably did just fine, sheltering in place, waiting for us to get there, and we got them out. The door makes a big difference. Fire message number 7, we just have one after this. Know your local emergency number, 911 here like we went over. Any visitors need to know this number too. We can post it near the phone if we want to do that at home. Once you've escaped a fire, call the fire department from outside for obvious reasons. We don't want to hang out in there. If there's a fire, we're going to call from outside, whether we have a cell phone with us or using a neighbor's phone. And if you notice in this picture here, see the numbers? That's a house number. Really important for us to be able to see that from the street as responders. I do have a program in town where I'm selling these big red signs. You may have seen them at some people's houses. They go on a post or they can go on an existing mailbox. They're $12 or $16 whether or not you want the post. But I do have one over there if you want to see that. And you can get those by calling the fire department or the COA, CFAL. We know that answer. Fire message number 8, this is the last one. Plan your escape for your abilities. An escape from fire looks different for everybody. We're all a little different. But basically, we want to have a telephone in the bedroom in case we need to make that phone call. And we want to keep some items near the bed, whether it's our glasses or a flashlight, anything that we use to walk, which I imagine would be there in the first place. And then maybe some of those emergency contacts like Mark mentioned, what might be a good thing to keep in the bedroom. So a quick review, and then we'll take more questions if you have them. What's the safest way to prevent fires if you smoke? There you go. I would agree with that. I'm not judging, but I would agree with that. But put it out completely, right? Or smoke outside. Yep, and smoke outside. Some items that should be kept near the bedside. We just went over this. Yep, phone, glasses. You got it. Yep, phone numbers. And how are we going to remember to turn off those space heaters? Give them space. But we got to turn them off when we leave the room too. So I don't know about you, but I keep Post-it notes around the house. I might stick one up and just say, because I have kids, I'm going to say, turn off that space heater before you leave the room. And how can we prevent a cooking fire? Don't leave the room. Just keep an eye on it. And this is our next portion. We'll do this after lunch. And that's all the fire messages I have for you today. Thank you.
Thanks, Rachel. That was great. All right, everyone. So I'm going to invite you guys to make your way to the back of the room and make yourselves a plate for lunch. We have salad, watermelon, sandwiches, chips, pretty much anything you could need. At the tables, we are going to have the presenters sitting with you, as well as Carrie Kelly, our outreach coordinator. She's in the back of the room, everyone. So if you guys have any questions or you just want to chat about what we've been going over this morning, there'll be a resource for you. So I'll have if you guys can all keep one seat at your table open so that we can get a presenter at each table, that would be great. Otherwise, enjoy lunch and we'll start back up in a little bit. before we get going again. So if you guys want to clean up, grab any other last snacks, and find your seat, that would be great. Thank you. Did fill out a hard copy. Feel free to just leave the completed ones on this table right in the alcove, and then the network can pick those up on their way out. So thank you guys. I hope everyone's full and ready to keep learning. We are going to bring Rachel back up to talk about fall prevention and safety at home. And then after that, we're going to hear from Lieutenant Sarah Harris and Bill Massey about situational awareness and fraud and scam prevention. So we're going to wrap up fire right now, and then we're going to move on into PD stuff. Thank you guys all for being here and being so good. I know it's a long day, but I feel like we're fueled up and ready to go, so I'll turn it right over to Rachel.
Thank you. Is my mic working? Can we hear me? Yes, I will speak a little louder this time. How's that, okay? All right, and just raise your hand if I get quiet again, because that's my tendency. I don't know if I could change my shirt, but I'll see what I can do here. Okay. Did everybody have a nice lunch? Good. All right, thanks for coming back. I don't think we lost anybody this time. Feel free to grab anything else if you need it. So we're going to go right into the falls program. The idea is just don't fall. Don't fall once because we don't want to wind up in this cycle over here. And I like this slide so much that I made it in my rendition on the whiteboard there too, because I'm going to be changing these slides, but I want us to pay attention to that graphic, because that fall cycle is the thing that we want to stay right out of. We want to avoid the first fall. Some of us have already had a fall, but if possible, let's avoid that first one, because that can lead to a fear of falling. That can then lead to decreased activity. It can also lead to decrease in muscle tone after the activity decreases, loss of coordination, and then we have an increased risk for falling because of those things. And this cycle is not a good cycle. We want to stay out of that. If something happens, we want to try to stop the cycle if it's happening. And we see this in our work as paramedics, EMTs. The fall is probably the most common medical call that we go on. The fall is not always a disaster or an emergency. Sometimes it is, sometimes it's an assist. We do a lot of assists for people who might have hit their medical alarm. They might not be injured. We pick them back up. They go on with their day, and that's the best fall. If you're going to have one, that's the way to go. Other falls send people to the emergency room. So 1 in 3 older adults is going to have a fall. That's what we know from the NFPA. That's the science. 1 in 17 are going to go to the emergency room. There's probably more who need to go, but maybe they don't want to or don't want to call. But just realize there's probably more than 1 in 17 that do need to go to the emergency room, and we can help sort that out on scene. I think Mike talked about refusals, patient refusals. We're not here to kidnap anybody, but we can always come out and do an evaluation and talk about what we found, and we might give you some reasons why it's a good idea to go get checked out. But we can't kidnap you. It's the law. We can't do that unless we have your consent. All right, so here's the fall messages. This is going to be your green page. If you have your multi-paper packet that I handed out, if you look at the green page, we have 8 fire messages. Just like we had the 8 fire messages, we now have 8 fall messages. So the first one, and they always put the most important one first. If you remember in the fire messages, it was, if you smoke, smoke outside. That's because all the statistics are saying smoking is causing the worst fires. So in this case, lack of exercise is probably causing the worst falls, right? So people who exercise are building strength. They have coordination. They have balance. A lot of these experts are recommending Tai Chi. Has anybody tried Tai Chi? Do we like it? Yeah. So they're recommending this Tai Chi because it's been known to reduce fall risk. The direct correlation there, and it's sort of like a standing yoga. It's very slow moving, sort of a meditative kind of a standing yoga, and it's not too strenuous. And they offer it here at the community center. There's actually a flyer on the board that I noticed in the lobby today that people can sign up for.
Just to plug Tai Chi at the community center. It is here. I believe it's Tuesday mornings at 8 a.m. But in the summertime, and I'm guessing probably now-ish, they moved to Chase Park. So it does take place outside. It's very peaceful and enjoyable. And if you guys have any questions about that, let me know.
Thank you. So we have a nice disclaimer on the bottom. Anytime you're trying a new exercise, you just want to check with your doctor. Even if it's a phone call and you speak with the nurse at the office, say, I'm thinking about trying this new exercise. Do you have any advice for me? That kind of thing. So we don't want to just go into a new exercise thing that we haven't tried before without just checking with the doctor. Not a bad idea there. Anybody have advice regarding exercise that it does for us adults? No? That's okay. Moving on. Fall message number 2, take your time. Let's get out of chairs slowly. We're not in a hurry. Sitting for a moment before getting out of bed is a nice idea. Stand and get your balance before you walk. Be aware of your surroundings. Look around you. Is there anything that might cause you to fall where you are? Maybe you're not in a familiar place. Maybe there's rugs on the floor. Maybe there's a wrinkle in the rug. I've heard about many people saying that they fell because of a wrinkle in the rug on the floor. Tripping. What's the strangest thing you've tripped over in your home? Anybody trip over things at home? In the back? The air. Nothing at all. My shoe. I've tripped over my own shoe. Animals, I've tripped over my dog. I can't count how many times. She's a little dog, so she likes to live under my feet. Fall message number 3, keep stairs, pathways, and walking areas clear. Things that we find in walking areas. We see this stuff on calls. I see this stuff at my own house. I have kids. They leave things in different places. But the common offenders are listed here: electrical cords, shoes, clothing, books and magazines, plants and tables. If you notice over here, we have a cord that is covered up with a smart piece of fabric there. So the only other thing I would do with that is maybe paint it yellow, but they wanted it to blend in. At least they covered it up, right? And it made it a little better there. But rugs can be a real issue for people, especially ones that have slippery bottoms underneath. And there's a way to handle that. We have this sticky tape. So this is 2-sided rug tape. You can get this at Ocean State Job Lot. You can get it at the hardware store or probably the grocery store. But it's very, very sticky. It has like a webbing. You stick it under the corners of your rug so that you can keep your favorite rugs, and just stick it down to the floor so it's not going to trip you or somebody else in your house. What can we do to keep our stairs clean? Put stuff away. Don't put things on it in the first place. Leave a little note. Take this up with you when you go, right? Handrails on the stairway. We want to keep at least one hand on the railing. 2 is better, but maybe we're carrying something. It's good to have handrails on both sides of the stairway at your home. These should be professionally installed. I've seen handrails on calls where somebody has fallen and it's away from the wall. And when I looked at where it was planted in the wall, There wasn't any wood to accept the screw that was to hold it on. So somebody had put that railing up and just, made it part of the sheetrock, which is a crumbly stuff, so it's not going to hold up. They need to be installed the right way, especially if we're going to use them to keep ourselves safe. The handrail should be used on the way up and the way down. And if you have to carry something, maybe it can be divided into separate bags. You can put a bag over your shoulder and get both hands on the rails. You don't have to carry everything up at once. If you make more trips, you get an exercise too. Improve the lighting in and around your home. Lighting is a big one. Most falls are happening, as far as our service is concerned, between the bedroom and the bathroom. And a lot of times it's happening at night. And a lot of times it's happening in the dark. And so I thought of all of you, and I brought night lights here today.
What are those? I thought that.
Yeah, they're little night lights. They have a sensor so that when it's daytime, they turn off. This plugs directly into an outlet. Hope maybe you have one in the hall. You want to take the plastic off first. That's just protecting the prongs. But please take one or two or whatever. These are also a good thing to pop into your luggage if you're going on a trip. This was a suggestion from my mom. And she does that, and I do too. Because you might be in a hotel room or Airbnb or wherever where there's just not enough light for you to be able to find the bathroom at night. And everybody needs to be able to do that. So let's light up our lives, right? Fall message number 4, improve the lighting in and outside of your home. Like I said, between the bedroom and the bathroom, there needs to be lights, especially for at night. Stairways need to be lit from the top and the bottom. We want to have easy to grip handrails installed properly by a professional along the full length of both sides of each stairway. And then we want to keep touch with our vision. We want to see an eye specialist every year. Sometimes that's the issue that people are having too. Anybody have lights with motion sensors outside? Nice. So those things are good for us to see. If we go outside, maybe we're taking our pet out during the night. But they're also good for keeping folks we haven't invited away from our house, right? I also brought a headlamp too. Does anybody have a headlamp? Yep, very, very handy. If you don't want to install lights, that's fine. But you can go around with one of these on. They're fun. You look really cool too. Fall message number 5. Use non-slip mats and grab bars in the bathroom. Non-slip mats are great in the tub and the shower. That's that photo on the top. That's for the inside the tub or shower kind of a mat. Then we want to talk about also mats for outside of the shower. This one I brought is a non-slip mat. It's got little pieces of rubbery backing here. And that way when you step on it, it's not going to go flying and take you with it. I also have an example of a mat that is not non-slip. It kind of looks like it is, but it doesn't have that rubbery feel to it. So I know it's not the safest one. Good to know. Grab bars. So the one that we're seeing in the picture here, that's the kind of grab bar that you want to have. I've seen some with suction cups, and they might work for a little bit, but they don't last like that. So we're not recommending any of the suction cup type grab bars. And I do see them in a lot of giveaways too. So people probably have them. They're not reliable, unfortunately. That you want the grab bar that's shown in that second picture there. That's the good one that looks like it's installed correctly. And it's going to work when you need it. Spills, we want to wipe those up immediately because you can't see it. You spill some water and then walk away. and then somebody else comes in, and a wet tile floor is just not a good friend of us. So those need to be wiped up immediately. You can do that with your towels. What kinds of things have we already done to improve safety in the bathroom? Any ideas? You got grab bars? Awesome, that's great. Yep, right in the shower. Some people have them around the house. I've seen them, between rooms where there might be a step. You go one step up into the kitchen sometimes, or a step up into the house. I've seen grab bars right there too, and those are great. Do you have that? Yeah, those are great. We love seeing these safety devices when we come and help people. Fall message number 6. Be aware of uneven surfaces around the home. I talked about the rugs because they hurt us so much. They hurt people so much. They're coming up again. I think this is the 3rd slide that mentions rugs. Rugs are a big offender. They need to be smoothed out. There can't be any wrinkles or folds in the carpeting. I think there's a trick where you can kind of put down a towel and you can iron a rug to be more flat. We're not asking you to get rid of your pretty rugs. There's ways to make them safer by keeping the wrinkles out and using that gripping tape that I showed you, the stuff right here. But if you're in the market for new rugs, just get the non-slip kind. They're much better. Uneven sidewalks and pavement. We just want to be aware of our surroundings, wherever we might be, outside of the community center, wherever you're at. There can be uneven sidewalks, and something this week might look different next week. So we're just going to be very aware with that. Ice and snow needs to be cleared, of course. Hopefully you can get a neighbor to clear that for you. That's a big offender. Any questions about this stuff? How about you?
Please. I've fallen and I can't get up kind of devices.
Yes.
Do you have any recommendations about when is appropriate or when it's time, or?
Sure, yeah.
How they
I
work?
think so she's talking about the medical alarm systems, and this comes up in the slideshow also, but just quickly, if anybody thinks they might need one, it's probably time to look into it. There's there's a world of different types and services, and they're sort of, as far as making the decision, there's usually a certain thing that you want to have with your service that will steer you towards some particular company. Some people want a system that detects falls. Some people want a pendant style. Some people want a wristband style. Some people want a button on their nightstand, and that's all. They don't want to wear any part of it. So depending on what your needs are, the choice is not easy. There's all sorts of services. It has to kind of use your cellular phone device as well. They kind of work in conjunction with each other. So there's a lot to it. And I'm told that the staff at the CFAL can walk people through that. And a lot of that reasoning is because there's people that have found things that have worked, and they go back to the CFAL and say, well, I really like the medical guardian, or I really like the life alert. And so they're able to say, well, our friends are using this, and so they know that it works and they like it. So it's like that. There's also there's the Apple phone. If people have an Apple phone, they can get an Apple Watch. They can get service to their Apple Watch to detect falls and to call emergency services without there even being a voice involved. So it detects a fall. We get a call at the station. We get like GPS coordinates, and we go there, and sometimes we find a person, but usually they've already left the scene. Or somebody calls and says, there's a fall that's happened at this address, and we already have it because we got an automatic alert. So they are very useful things, but they're all very different. So making the decision can take some time. Anybody done something to make their flooring safer at home? Another thing about the showers, if you don't want to get one of those mats, they're sometimes not easy to clean. They can get moldy under the suction cups. They have stickers. There's stickers that you can put in your tub or shower that can serve as the non-slip use. Fall message number 7, wear sturdy, well-fitting shoes. I see a lot of sturdy, well-fitting shoes in here. Low-heeled shoes with non-slip soles are best even indoors. These are safer. This is common sense. These are safer than high heels, thick-soled athletic shoes, slippers, bare or stocking feet. Surprisingly, we see a lot of people who fall and they have bare feet. That's because when you have bare feet, you're barefoot all the time, and the skin kind of develops a callus, and that's a slippery thing. Sneakers aren't as slippery. Some slippers have good traction, but bare feet don't have good traction. Most socks don't have good traction unless they're like those hospital socks. Have you seen those with the grippy bottoms? Those are a good thing. I have my slippers here. Have you heard of Crocs? So these are not Crocs. These are a knockoff because I don't want to pay for Crocs. But these are what I wear around the house as slippers. They got pretty good traction. They're grippy. And they work great. They keep my feet warm enough, and I can get around pretty good. So, knock off Crocs. What are some things we can do to keep safe when we're walking? This must be the after lunch crowd. Sure. Yeah, there's, you know what?
Coyote eradicator.
Coyote eradicator.
Coyote, you could always whack it.
I love that idea. You can bring a cane. Earbuds. Yes, so not wearing earbuds is safer than wearing earbuds because you can hear the traffic around you. Yeah, or a bicycle. You ever have a bicycle come up from behind you on the bike path? And you can't hear it if you have earbuds on. Yeah? Yes, yes, it's a pretty good idea to walk in on the side of the road that's facing traffic so you can see it coming. However, if there's a sidewalk on the other side, I would prefer that. Yeah, so when there's not a sidewalk, you want to walk against the traffic. And I want to say these poles are a great idea for walking. They are lightweight. They're intended for walking. They're not for skiing this time. They're just made for walking. So they're a great way to, if you don't want to carry a cane or whatever, you can go with some of these walking poles. They're super handy, and they're very easy to use. Oh, is that right? A little bit of arm workout too? Good, thank you. Fall message number 7, have a list of your current medications. Keep the list updated. Put a copy on your refrigerator. Share one with a family member or a friend. Add your emergency contacts. Pick up a file of life from the fire department or the CFAL. Does anybody have a file of life? Good, more than half of you. So this is a magnetic file of life. It's a little pocket right here. In the pocket goes this little document right here. It has basic medical information. It has 2 sides. It folds up and fits right in here. You can also add any advanced directives if you have something like that, or whatever you want to. This will stick to most refrigerators, not all of them. I know some people have a non-magnetic surface on the front of their fridge. Maybe the side of the fridge might grab this because that might be metal. Or maybe you just leave it in a visible location in the kitchen. This is for us to find, for you to use, but for us to find our EMTs or medics to find when we come and visit. We can find one of these, and then you don't have all this explaining to do. We can just read through it, and then you have a break, because we have all your information right here. And the key is to keep it updated. Some people have these, but they don't replace them. You can always come back and see us, replace this, put a brand new one in there with your updated information. And again, it goes on the fridge or in some very visible location. Okay? That's the file of life, and we have those right over there. Help yourself. Yes?
I was given one of those. They also gave us a mini.
Yes.
And they also gave us a mini file of life, which I keep in my wallet.
I like that.
And I would love to see more of these around too. Because if you're shopping or something, you always have, or driving in your car, you always have your wallet with you.
Yes, I like those too, and I'm trying to find them, but I'm having a hard time, frankly. We're working on it.
I keep a list of
Do they?
medications on my cell phone, file on my cell phone.
That's a nice idea too.
List of medications.
Yep, we can keep a list of medications right on our cell phones, and like Mark said too, any documents that you might need in a storm if you're going to evacuate, right on the cell phone, and on there goes your list of medications. That's a great idea. Anybody else? This is what the most and advanced directives look like. Sometimes people have those tucked right in the file of life. It can fold right up and go in there. Good place to keep that too. Question? That is up to you and your doctor. So if you have both and you want to keep them with your file of life, then that's a great idea. Yep. Not everybody has both, but if you have those, then they can go right in there too. Reviewing medications with the doctor. Some of us are taking lots of medications. If you're ever having a question about what side effects might be happening, or if you're feeling something that doesn't seem right, you're on a new medication, go ahead and talk with your doctor about that, or the nurse at the office. You can also call the pharmacist and talk about side effects. Interactions with alcohol and other drugs, that's something we want to avoid. And be aware that medications can affect our balance and make us feel sleepy. So it might not always be a good time to drive or cook food. But when it comes to medications, taking them as directed is always the key plan there. Consider a medical alert device. We talked about that. Especially if you're living alone or if somebody's alone for long periods of time, that's especially necessary. These things are saving lives. They do cost money, but it's worth it if it saves a life, right? Does your home have a lockbox? Anybody have a lockbox? Awesome. I have one over here if anybody wants to see it. It's really just a tiny little metal safe that the fire department will install on the front of your home, wherever you want it to be, or usually in a visible location. And it contains one key, so you'd have to come up with a spare key. They cost $85, and only the fire department can get into that lockbox. And it's great for emergencies, because if somebody has an emergency, whether it's smoke alarms or a medical emergency, we have a key on each of our fire department vehicles, whether it's the ambulance or the engine. There's always a lockbox key. We can get into that lockbox. We can open your house with your own key, and then that way we don't have to do any damage. If somebody doesn't have a lockbox, we'll still make our way in, but there might be a little cleanup after that. And you can get those by calling the fire department. They're $85. Very helpful. Any questions about the fall's messages?
About 2 years ago, and last summer I asked them to come out and check it. They
Uh-huh.
couldn't open it, it had corroded.
Oh my.
So if you've had one for a long time, you might have the fire department check it. You might need to have it replaced.
That's a great idea. Yep, I did not include that. I appreciate that idea. So if you've had a lockbox for several years, this woman had one for 20 years, and then so she had us come out and checked it. It turns out it was corroded and unable to open. So the weather will get at it eventually, but if it doesn't look like it's going to work, it probably won't. And let's replace those ones. And anybody who has a financial concern, we do have donated lock boxes. People buy houses that have lock boxes, and they say, come take this off. We don't need it. So we go and we bring that back to the station. We hold on to those for the next person who needs one. Any other questions? They're $85 installed. Yep. And nobody can get in except for the fire department. True. Yep, the fire department installs them.
What's the statistics on how many people wear those medical alerts?
That I don't know.
I think it's a lot.
It's a lot. We do see them on a lot of people. Yeah.
A lot of people go to the Squire on Saturday night.
Really? People at the Squire on Saturday night are wearing medical alarms. Okay.
Do you have to register one of those?
They don't register with us, but the medical alert systems, they do have a center that monitors and provides the service. So that in that sense they're registered. But no, not with us. Anybody can get that anytime. Let's review. Name one change you can make in your home to reduce your risk of falling. What's a good one? Grab bars. You said rugs, tape on the rugs. Good. Non-slip tape. Pick up the clutter, put it away, or out of the way. Grab bars are a great idea. I will say the non-slip stuff, it doesn't last forever. You do have to peel it off and replace it from time to time. I know that from personal experience. Why does regular exercise reduce one's risk of being injured in a fall? Makes us healthier, yep. Makes our legs stronger. Good muscle tone, improved balance.
Bounce better.
You bounce better.
Stay out of the water.
Yeah, when you fall, you don't land, you just bounce. And here's my information again, if anybody didn't get it. And remember to fill out the evaluation form. That's super helpful. This is the first time I've shown these two sets of slides, so I do want to know what people think, if it's good or if it's bad or whatever. And then just remember, over to the table, we have oven mitts for you, file of lifes, replacement papers today or at the fire department or at the CFAL. Please take a night light and bring it on a trip. These are for opening jars. Plus, they have fire safety tips on there. And then the clip that says no two ways out. Good reminder, just to think about stuff like that. There's also some business cards to help you remember the phone number, remind you to call when you need to, but 911 for emergencies. Thanks, everybody.
Thanks, Rachel. And to plug an upcoming program with Rachel, she will be at the CFAL on Monday, June 16th to have a little coffee hour, meet and greet. I think she might bring some other folks from the fire department to hang out with us. So if you are interested in joining, please just give the CFAL a call. Next up, we have Lieutenant Sarah Harris. She's going to talk about situational awareness, and then we'll welcome Bill Massey to discuss fraud and scam prevention. You guys are doing great. Thank you all.
Come up and help me too.
Yeah. If that works. Yeah.
I do not. Look at that, I almost fell over the cord. That'd be a way to end it, right? I can talk. Can you all hear me? Everyone's like not answering, so you can't hear me enough. Uh-oh. I know, but it's also the, this is the clicker. Handed me the, I have so much hanging off me here. Now you can hear me. Sorry to give you more. That's okay. There you go. A little bit about personal safety and situational awareness, but before I start that, a few police department tips. If we stop you in the car and it's nighttime, do us a favor and turn the lights on inside the car. Then we know you're a good person. And I kind of evaluated everybody coming in here tonight, and I felt safe coming into this room because I looked at my situation. I knew my exits, and I looked at you all, and I said, I feel kind of safe with them today. So, but as as police officers, we stop cars at night. We don't know who, what, where's in that car. We have to evaluate as we're going into that car. We might sound rough and gruff and angry, but we're just trying to make the town safer. And if you help us and turn the lights on inside that car, it gives us a better view of, hey, everything looks a little safer in that car. It's just one little tidbit from us. Another thing is we do wear body cameras now, so the officers will announce if they do come to your house. We might be there for a medical or to assist. We should be announcing that we have this on, but we are recording. It's just for your safety and our safety. It's not an intrusion, but if you ever want us to turn it off, you can ask us to turn it off, and then we would decide if the situation is allowable to do that. But I'll talk a little bit, like I said, about our personal safety and situational awareness. Let's see if I can get this right. Personal safety. Personal safety is being able to recognize when certain situations have the potential of becoming hostile and the threat of violence is present. We've seen a lot in the news these days. There's just a lot going on. So the environments that you put yourselves in, I want you to be safe and be able to get out and be able to go home safe every night. What is violence? The intentional use of physical force or power, threatened or actual, against another person that either results in or has a high likelihood of resulting in injury, death, or psychological harm. A lot of these are kind of morbid, but I'll try and make it light. So, hostile situations. Has anybody ever been in one, felt one coming on, been worried about one? Does the hair on your neck ever stand up? Your gut kind of tell you, maybe I shouldn't be here? Trust all those things, please. I tell that, and I preach that to the kids. I preach that to everybody. If something doesn't feel right, go the other way. But hostile situations, a situation in which your location becomes the setting of a violent incident, no matter how small. Sometimes the environment, you'll see the first level, it's hard to see this slide, but behaviors of concern or risk factors. If something just doesn't feel right in the room, you see somebody enter, they're already angry, get out. But then it can go up. Emotionally abusive behavior, aggressive behavior, hostile behavior, non-fatal assaults without weapons, non-fatal assaults with weapons, violence causing physical harm, and fatal violence. So as we've seen on the news, things might start here, quickly go to the top, and become morbid. De-escalation is big in police work and just in the general population these days. It's a highly used word, but it should be attempted whenever feasible to mitigate an elevated, escalated situation. We use these with mental health. We use this when we pull somebody over and they're all of a sudden in a hurry and they're angry that we pulled them over to slow them down, and they might be angry, and we talk them down and explain what we're doing. So de-escalation is a huge tool that we use, but it's critical in these type of situations if you're ever in an environment that you need to help de-escalate if you can't get out. De-escalation techniques should be used to slow and settle the immediate situation down. The idea is to bring down the level of crisis that someone is feeling to a calmer and more settled state, so that whatever next steps need to be taken with the subject can be completed in a safe and smooth manner. Slowing the situation down is critical. It is important to note that time is on your side, and there is no reason to rush or hurry the subject during any encounter. These are just some more, like I said, slow down, buy time, listening thoroughly. If someone comes into an environment and they're violent, comes into a meeting, comes into the CFAL, we've done a lot of trainings with staff at the town hall, at churches, at CFAL, at the town annex. A lot of different groups have had us in larger environments to say, they talk about this a lot at the voting areas, any big, large-scale events on what would you do if someone came in to a town meeting and was angry, and you saw them angry, and they started getting angry and started escalating. These are the different things to, create distance, do not interrupt them, empathize, build rapport, be aware of your own body language. You can say things, I understand your frustration. Let me help you get some more information about some alternatives. We can work and figure this out together. I'm just going to skip through these because we're going kind of quicker today. There we go. But if you see something, say something. If any suspicious or concerning activity or statement should be reported to a staff or police promptly. If you're sitting at church and you see somebody come in and they have a suspicious package, or they're just not your usual churchgoer that you know your environment, say something to the staff, say something, call police. Even if the person is known to be difficult, their baseline behavior is difficult, don't let it become acceptable behavior. If that person, oh, okay, maybe they're fine. I see a lot of people justify, oh no, it should be fine. Oh, it'll get better in a second. Oh, maybe they're just having a bad day. Maybe this. Why let it go that far? Protect yourselves. Because a study in the U.S. Secret Service revealed that in nearly all mass shootings in the United States, shooters had made threatening or concerning communications that worried others before they struck. So we do, in our police work, we see, oh, I should have called yesterday when I heard that gunshot. Oh, I thought I heard something, or something didn't seem right about that person. I should have said something earlier. I tell people all the time, please we don't mind coming to your house to listen to your story. If you hear something outside, we don't mind coming and finding the raccoon in the backyard. Call. If anything's concerning to you, we will help, staff will help. We'll all make it safe together. I'm going to skip that one too. Do I? Maybe it doesn't want me to skip it. Three factors creating violence: the individual who takes violent action, the stimulus or the triggering event that condition to make that person feel like they have no way out, and a setting that facilitates or permits the violence, a setting in which, there you go. But when you see something, so when you observe something, you want to always go into an environment and observe your environment. Orientate yourself. So when you came in here today, didn't you know where your exits were? Have you been in this room before? Yes, maybe. I do. Like I said, I look at everybody that's in this environment. An example, the other day, we did the Memorial Day ceremony out front here. And yes, we were on the street and we were outside, so I knew I had exits, but I looked at the crowd. I saw that there was some people standing on the staircase. There's a lot of elderly in the crowd. Some people, it's a warmer day. I'm looking, if the person next to me suddenly passes out because we're all standing at attention, how would I catch that person? Or what would I do? And I'm as a police officer, we're a little hyper vigilant. I don't want you to make you guys worried in every environment. You should be able to enjoy where you are, but take a look around. The group that you're with, are they safe? Are you safe? But observe, orientate yourself to where you are, decide whether you have to take any action if something happens, or decide what your action would be, and then make sure that you're able to act. That's what they call the OODA loop. You keep thinking about that, and it shouldn't be overpowering, it shouldn't ruin your day, but kind of always orientate yourself to where you are and what you're doing, nighttime or daytime. So again, I explained that already. I don't know if I'm going to be able to make this play. This is a town meeting. So pretend you're here at this town meeting. I'm going to pause it at certain spots. So.
From Ms. Littleton to approve for advertisement, School Board Policy 7.305.
This has really been a situation that really affected elementary school a lot more than
everybody in this room.
Any reaction to you all?
Situation that really affected elementary school a lot more than
everybody in this room, except the assholes behind that counter,
swearing,
hit the road.
Has a gun in his hand. I don't hear any running. I don't hear any screaming. Everybody that's behind there has time at this point to get the heck out of there. There's a woman sitting right there. I'm not going to push too much of this.
Leave. You may leave, you may leave.
He's telling people to leave at this point,
He
so
told
I'm
you
sure
when
as
he-
heck listen to him and leave. He's upset because his wife got fired from the school. The staff doesn't even know who, so one of those people had signed the paper that oh, sorry. The fellow was upset because his wife was fired. She worked for the school committee, and he went in, decided to go to the meeting, and obviously he has some mental health issues, but anybody that's there might not have expected him, or maybe they saw him walk in earlier and didn't feel good about him, or maybe some of them already knew that he was an upset person. I don't know, but I'm not going to let the rest of it play, but it took a long time for people to decide to get out. He eventually did remove, oh yeah, hit next, sorry, yeah.
That was a real situation?
Yep. Yeah, and they film all the school meetings, but that's every day somewhere, situations like that. Luckily not in Chatham, we haven't had anything big, but it doesn't mean it's not going to happen. So the more people that are aware and the more people that can protect themselves helps us when we respond. I want you to call me and say, hey, this doesn't feel good, something's not right here. You go make yourself safe and I arrive. Another one of the police tips I wanted to tell you is, if you see us at a scene managing something, if you see us at a crash scene, directing traffic, or you see me on the side of the road and obviously I'm doing something, I want to be kind to everybody, but a lot of people stop and they say, oh, what's going on? And it's very difficult for us because, one, we usually can't tell. Two, it might be somebody behind me died and I don't really want to talk about it. Or three, I'm directing traffic and I'm just trying to move you along. You're going to find out on Facebook later if it's something important. Please just help us out and don't bother stopping and asking for the question because it's a very difficult thing. So pass that on to your friends too. Like you will find out immediately, like I said, on Facebook, or someone will alert you if it's something you do need to know about, or all the neighbors will talk about it. But if you can not bug the police when they're trying to manage a scene, we appreciate it. But also on the flip side, if we're directing traffic and you're in your car and you're just pointing you want to go somewhere there, do me a favor, roll down the window, tell me where you want to go, because I will help you get there. Because sometimes people will point and I can't tell. You have no turn signal on. Give us a hand sometimes. Situational awareness. So like in that video, be aware of what is happening around you in terms of where you are, where you're supposed to be, and whether anyone or anything around you is a threat to your health or safety. If you're down in your phone and you're not paying attention to anything that's going on around you, you're going to miss something. Same thing if you're on your phone and you're trying to drive, you're going to miss something there also. Improving your situational awareness. Learn to predict events, escalating behavior in others. Identify elements around you, just like we were talking about. Start by noticing threats that are around you. Monitor, detect, recognize multiple situational elements. Trust your gut. Trust your gut. It's so reliable. You guys have been through a lot of things in your life. You know when things are good or bad. You don't have to trust anybody. It's inherently in our human nature to trust people. You don't have to, though. You have to trust yourself and your instinct and protect yourselves. I wanted to watch this video because it's kind of fun. Let's see if I can make that work, though.
Here's your challenge. How many people in orange shirts get subs? Go. Seven people in orange shirts got subs. But what else did you see? Did you notice the ice cream truck change to a pizza truck? Did you notice the glasses? What about the man leaving the suspicious package next to the truck? Your next challenge, be aware of your surroundings. If you see something suspicious, say something to local authorities.
So again, that's a little funny, but it is, you're not going to win on any of those. They'll trick you every time. But your level of awareness, again, I don't want you to be tuned out walking around the world, and I don't want you to be hyper-vigilant, making yourself sick and stressed all the time. Somewhere in the middle, your focused awareness and your relaxed awareness is where you should be.
Here's your challenge. How many times is the yellow backpack passed?
So in 2024, there was more than 488 mass shootings across the U.S., according to the Gun Violence Archive, which defines a mass shooting as an incident in which 4 or more people are injured or killed. Their figures include shootings that happen in homes and in public places. So like I said, you've seen a lot on the news. We're trying to stop more of them, but the way we can stop more of them is having people aware of their environment and helping us find things. A welcoming environment does not mean a defenseless one. I keep using churches, but town meetings, you want it to be friendly. You want to be welcome in Chatham. But like Walmart does, what do when you walk into Walmart? They greet you. So just by greeting something, the bad guy doesn't want to be known, doesn't want to be recognized, doesn't want to be seen. It adds that. So again, your welcoming environment can also be, hey, I saw you. Hi, welcome to here. That could make avoid a critical situation. They do teach run, hide, fight. I'm going to go through this a little bit quickly. Let's see.
Hi, can I get you started with drinks?
Oh, sorry, I gotta take this.
We'll need a minute.
Instructions. I'm in the direct line of fire if I head for either exit, but I have other options to help me survive. Guys, come on, in here. Lock and barricade the door.
Both my exits are blocked by the shooter. I gotta stay hidden. I'm no victim. I'm ready for this.
He's applying direct pressure to the wound to stop the bleeding until we can find a tourniquet. In the meantime, turn off your phones and make a plan to defend yourself.
We got him right here!
Please, show me your hands!
Over here!
You can survive a mass shooting if you're prepared. away from the attacker. Don't hesitate. Seconds matter. Remember windows and emergency exits. Leave belongings behind. Keep your empty hands raised and clearly visible when exiting a building. Follow all instructions from the police. Don't stop until you're sure you've reached a safe location. Hide. If there is no safe escape route, find a good hiding place. Lock and barricade the door. Silence cell phones. Prepare a defense plan. Fight. Fight only as a last resort. Use available objects as improvised weapons. Use teamwork and surprise. A coordinated ambush can incapacitate an attacker. You're fighting for your life. Don't fight fair. Stop the bleed. A victim can die of uncontrolled blood loss in 5 minutes or less. Apply pressure or a tourniquet to control severe bleeding. Go to fbi.gov/survive to learn more.
The run, hide, fight. Flight is the best. Get the heck out of there. Get the heck out of there. Give us the information that you have that you did see inside. You can be observant, but keep yourself safe. Go. Always be aware of alternate exits. Keep hands visible when exiting. Lock and barricade a door if hiding your best option. And know the basics of first aid, which you guys learned this morning also. And I'm going to go through these because we want to get. Sorry, I'm going to go for the run, hide. The slow. Run, hide, fight. Go ahead, one more. Is that it? I know I kind of raced through a lot of that quickly. It is kind of morbid. I just want you guys to be a little more aware. I've been teaching it, even we teach it to kids in the schools to keep their head up. You know, they're studying, they're learning, but situations change quickly. People come into environments. We do deal with a lot of mental health issues, and sometimes people's moods, sometimes the drugs, sometimes just illnesses. We have people that are suffering from an illness, and they may change and become violent, and they don't even know that they're becoming violent. And you just want to remove yourself from the environment and call for help, and we'll come and help, and the fire department. Do you guys have any questions on any of that? Go ahead.
What if the situation has already and there's another person at risk and you can't get there in time?
It's a lot of it is instinctual decisions. If it's your child, if it's my child, I'm staying there to help my child. But that's where the de-escalation comes in. So the distraction, the de-escalation, the talking to people, the buying time, engaging if there's a serious situation.
So you would suggest getting involved, not just running from that.
It's all a what if. You know, like I said, if it's my child there, I'm staying with my child. But if somebody else is already injured and they might need help, go get them the help. Get out of there. Save yourself. I want one less victim. I want you to be able to come out and tell me what's going on inside, what I need to respond to. I want somebody to get out and call for help. I want everybody, as many people, to get out and save. Like she did in the video, if you're a situation and you can grab 4 people with you and say, like the one woman was going down the stairs, she says, don't go up there, come back with me. The other woman pulled 4 people into the room with her to barricade. If you have that opportunity, save yourself and others, certainly. Your spouse, like I said, your children, everyone's going to have a different, and some people shut down too. And if that's what it is, that's a protective measure, and that might protect you in the way that you need to be protected. But if you keep thinking about these things, like, I mean, we drive to calls and we start thinking of the whole scenario of how we're going to react when we get there if this, and this is happening. Or I'm responding to a fight at the Squire. I'm hoping that people have removed themselves from the Squire and get out of my way so I can deal with the fight that's there. So as we're responding to these intense situations, you know, sometimes, like I said, it's the mental health and it's the mother trying to control her child because they're having a mental health episode. Well, I want her safe too. If he's wielding a knife, I want mother, and my dispatcher's gonna tell that mother to get out of there and let the police deal with it. Excuse me. So there's a lot of what ifs, but I really trust all your guts here and go by your best thought and thinking. Yep.
An off-topic
That's fine.
question, but are you able to tell us what all that stuff you have on your belt is
Should I do a
about?
little display? Sure, I know. Today we're just doing 2 topics, and there's a whole gamut of police stuff that we can do. Sergeant Massey does a great job every year of teaching the Citizens Police Academy, and I don't know if I reckon, Creighton, I know you've taken it. A couple of people I recognize from past academies. If you ever have the opportunity, he starts teaching it in the fall. He takes applications for it. Please join us because you learn so much about what we do and the craziness that we have to manage, handle, and the rules we have to go by. But yeah, generally, this is my taser holder, which I don't have one in right now because all the other people on patrol have it. My radio, my extra magazines, my handcuffs, my OC spray, the gun, obviously, and then I usually have, my pouch broke, but I usually have gloves in that pocket. My radio, my camera. This is just for you guys. I think that's all I have right now, right? Huh? My bulletproof vest, yeah, and my handy dandy boots. So I have about an extra, I think I've weighed it before, it's about 23 pounds extra on us for a day. It gets a little warm. 4th of July, when you see us, be glad that you're in the air-conditioned car, because that's what people seem so angry they want to get out of there. And I'm like, hey, it's okay, you're in a car, relax. And I'm standing here trying to move traffic around, so yeah. Bear with us. I mean, I think as a police department, you guys have a great one here. We try and help out. We work out great with you guys. You guys are a great town, support us really well. And I'm going to have Sergeant Massey, though, because this is a huge, I think he's talking mostly about scams and scam prevention. It's not just, it's all populations. It's the kids are getting scammed. Everybody, you get that text alert that, oh my goodness, I didn't pay my bill. And it's not true. So. Yep, thank you guys.
Well, before we turn it over to scams, I will just say I had a call yesterday from someone in the community who received an email saying that their Stop and Shop Go points were expiring. And unfortunately, she didn't recognize the signs of fraud, but it does sound like that's the new something that's going on. So if you get an email about your Stop and Shop Go points expiring, maybe don't click the link. Just when you're at the grocery store next, talk to them or check your app. But just be careful. And I know that Massey here is going to talk all about that, but I wanted to let you know there's something new every single day.
Hello, everybody. I don't have any videos. Sorry. What else? I don't have any cool music or anything with mine. I do have some pictures, though. So I have some pictures. So for those of you that have not met me before, I'm Bill Massey. I'm a sergeant with the Chatham Police Department. My current role is I'm assigned as the school resource officer, and I just came from the middle school, so I just had to de-escalate a cafeteria issue. It was a very heated discussion at a 7th grade table about why an orange is called an orange. And I said, well, because oranges are orange. And this student wisely looked up at me and said, then why isn't a banana called a yellow? I didn't have an answer. So I said, I gotta go to the You guys work this out and I'll come back and check on you a little later. So I know it's a tough thing to follow being the last one of the day, certainly after lunch, so I'm aware of that. I'm going to try to go through what I think are the most important slides and the content for you as far as scams, fraud, and also some travel tips. And I see some familiar faces. Creighton, you've probably seen a variation of this slideshow that you could probably do it.
Yeah, that's quite all right.
Okay,
you're
good.
the expert.
Because I've still got a banana crisis at the school that I'm just hoping it resolves itself. But anyway, these are things that I think we can all relate to, and I'm sure you'll see a couple of pictures in the slideshow that will have some meaning to you, and you'll say, you know what, I've seen that email, I've gotten that email, and I'm going to tell you why you should just delete those, okay? So it won't be long today. We're going to talk about cybercrime, we'll talk about internet fraud, and I'm going to touch on social engineering. If that's a new term to any of you, I'm going to tell you what it is. very easy to identify once you know what you're looking for. And then I'll give you some tips to minimize your risk in general, whether it's at home on the computer, getting a phone call from an unsolicited telemarketer, being out in the community, or even traveling, because I know a lot of people like to travel, and I'm one of those people. So, does anybody want to take a shot at what cybercrime is? No, but I bet you know what it is, right? You probably can't define it, but I bet you know what it is. You may not be able to define it, but when you see it, you know what it is, don't you, right? That's what's important. But just for the sake of our discussion today, it's using a computer or a similar device with an intent to either trick someone or gain their personal information or something, usually for monetary gain. That's the big one. That's what we're most concerned about, cybercrime. That's what it is. Do you know why bank robberies are so infrequent these days?
They make more money this way.
Because they get way more money this way, and they can hide behind a computer and do it. There's very little risk for them to do this. And we make it easy for them, but we don't have to continue to do that, all right? The other reason that it's easy for them is because we have increased our reliance on technology in almost everything we do. How many of you have recently had to make an appointment to renew your driver's license? You can't just show up anymore and do it, right? You gotta make an appointment online. Have any of you gone to Harbor Freight to buy a hammer on the cheap, right? Can I have your phone number, your email address? No, I'm just trying to buy a hammer. Everything is connected to who we are, and that's a lot of it is to do with marketing. So if they see that you're buying a hammer at Harbor Freight, maybe their partners at Harbor Freight might want to sell you some nails. Because hey, the guy's got a hammer, so must need some nails to go with it, so maybe he wants to buy my nails, or she would like to buy my nails. So it's all really connected. And as we increase our reliance on technology, our increase in victimization also goes up. Being aware of that is step one in keeping yourself safe. So as we increase our risk of victimization, we have to increase our awareness and our action. It doesn't mean that we need to be paranoid. It just means that we have to take things a little bit slower and understand what it is that we're doing, and that some of the things that we do online could put us at risk. This is the global loss that's estimated by 2026, $20 trillion. That's going to get passed on to us, right? We're going to pay for that somehow. We may lose it, but we're going to end up paying for it in some way or another. These are the top 5 cyber crimes. Phishing. I'm not going to talk about all 5 today. I'm only going to focus on the 2 that are most important to those of us day to day, and that's spoofing and phishing. That's phishing with a PH for all you Chatham people. It's PH phishing, not an F. So spoofing is a scammer pretending to be someone else to gain the trust of a user in an effort to gain access to a system and do damage. Whether that damage is to wreck their system, but in our case, as regular consumers, it's to get something from us, to get money from us, to get our account credentials from us, to get anything from us that is going to help them. And if they don't get it from us, they're quickly moving on to somebody else, because there's some sucker out there, and I don't like to use that word, but we all understand what that means. There's somebody out there down the line from you that's probably going to eventually give that to them. It's just like car break-ins in a parking lot. If somebody is at, let's say, Stop and Shop parking lot and they're trying to break into cars to get something, they're not smashing windows anymore, folks. They're just going to see which doors are open. And if your door is locked, they're going to the next car. And if that door's locked, they're going to the next car. Until they find somebody that left their car unlocked, because that's their easy target. It's a similar idea. Here's some spoofing prevention. So these are things that you should do in general to your computer systems and your networks, or your phones if applicable, to minimize your risk. Use antivirus and other security protocols. If you have Xfinity or Comcast, that's probably the most prominent carrier, they have tools built into things that you're already paying for that can help you do that. So if you're already paying for it, there's no need to buy it from somebody else. Contact them and find out what it is that they can do to offer you to get those things turned on or activated in your computer system. If it's already there for you, don't buy it from somebody else. You're already paying for it. Avoid shared or public systems. This is tricky. A lot of places that offer shared usage of computers, like the CFAL, they have firewalls and they have some security procedures in place that will protect your data, but maybe those aren't the best places to be doing financial web surfing. Those are the things that you should do at home, right? Look for grammar and spelling inconsistencies. Who's ever gotten the email from someone? We've been trying to contact yous for some times to help you restore and get refund for the thing that you buy. Right? If you see something like that, no, this is nonsense. It's AI generated or somebody with very poor communication skills that doesn't represent a good company. Delete it right away. Those are the things that you look for in an email, in a text message. Spelling errors, grammar mistakes are quick telltale signs that it's nonsense. Use 2FA, two-factor authentication. Is anybody familiar with that? You are. Does anybody want to try to explain what it is?
Well, when I call my insurance company, they have to send me a code that I have to send back to them.
Yes. So I'm looking at booking a trip in December. So I'm going to a airline website. I won't say which one, but I go to their website, and even though I'm a member and I've registered my account with them, it says, hey, we recognize you're trying to log in. We're going to send you a 6-digit code to your email that we recognize and we know it's you. So when you get that code, put it in here, and then you're going to be able to surf and try to find your travel plans. A lot of places are doing that. A lot of places mandate it. If you are able to use two-factor authentication, it is a great way to minimize your risk of being scammed, because then you know that anybody that gets into your system has to have that code. Hopefully I'm not going a little too fast, but two-factor authentication is something that is very helpful in keeping our risk of our minimization down for risk. Phishing with a PH. This is social engineering that uses authentic looking but fraudulent websites and places to get you to make you think that something's gone wrong or that you owe them money. And I think I heard Lieutenant talking about, hey, you didn't pay your Eversource bill. Click here to make a payment right away or we're going to shut you off. I know of, and Lieutenant Harris knows of, far too many instances in Chatham and on Cape Cod where people, businesses, and homeowners have fallen victim to this and thought, holy cow, I don't want my electricity to go off. I don't know what happened. I'm going to click here, I'm going to pay it, and then I'm going to try to find out what happened. Eversource does not extort us that way. They just don't do it. They give us letters and emails. They're going to give us every opportunity to pay what we owe them before they shut us off. So here's what some examples of phishing looks like. You'll get an email. We've noticed suspicious activity on your account. Click here to verify by entering your username and your password. No, that's phishing. That's them trying to get your information, but it's authentic looking. Your account is on hold because you need to update your profile. Again, probably a fake thing. Your payment could not be completed. Oh, my payment, I don't want to get a late charge. Let me click on this and get that rectified right away. Here's one that's becoming more and more popular. Because of an error, you are being refunded. Refunded? Click. Sign me up. You're going to give me money? Great. Right? No, these are probably scams. So this is what they're wanting you to do. Click this link to update your profile, complete your payment, enter your billing information so your refund can be processed. Those are no-nos. This is what they look like. These are actual emails that I've received on my cell phone, right? So those look pretty good, right? Right. Don't those look pretty legitimate? But if you look up top, as my good friend here has done her homework, if you click the link, there's a laser here somewhere. Hey, I found it. If you click these links right here, that's going to bring you to these places. All right, invoice at payment.pay.com. That doesn't sound like Amazon to me. No. Oh, the IRS? Oh, I don't want the feds after me. Invoice at payment.pay.com. You mean Amazon and the IRS are working together? Well, that might not be a big stretch actually, but those are not legitimate emails. They look legit though, don't they? I mean, that looks like Amazon's logo. I'm sure if we really sat here long enough and broke it down and studied the actual one, we'd find a couple of minor differences. But those are pretty authentic looking. So to the untrained eye, or the person that doesn't want to get in trouble, you may click that pretty quickly to get things resolved. Yes, sir.
I've been clicking, I got one from Verizon last week, and I clicked reply. It's not any of the link, just click reply, and lo and behold, the address comes up, Mildred something at .ru.
Or you hover, you let your cursor just kind of, don't click it, just bring your cursor over the reply button right here, or right here, or right here, and a box will open up and tell you where that's going to go if you click it. And if it goes to Mildred or Samuel at so-and-so.com, you know that that's not legitimate.
The other thing I do, I get these several times a day. I click on the sender and I see what the email address is, and they're all these JB, crazy
Great.
numbers, and that I just find.
So it sounds like many of you are already in the know on this, and that makes me feel really good, very happy. But we still need to keep our eye out for it. And I understand being curious, but I think your best bet is to, if you recognize it as potentially fraudulent, just delete it right away. Don't even pay it a second thought. Just get rid of it right away. Phishing prevention. Again, with a PH, update your computer or cell phone regularly. If you get those updates, and I know they come usually at the most inconvenient times, use the updates, because a lot of those updates include security firmware updates and security updates. Look for grammar and spelling inconsistencies, and again, use that two-factor authentication. Always reach out to the company. If you do business with a company like, I'll pick EF Winslow Plumbing, because we had them at the house doing some service at our place. If that's a company that you regularly do business with, and you get an email that says, hey, this is EF Winslow, there's a problem, call them. Hey, it's Bill Massey, I just got your email about something. No, we didn't send an email. Okay, thanks. Well, somebody has my email address or something, so just be aware. Or, oh yeah, we've been trying to call you, but your number is not correct on file. Verify it. And maybe there is something that you have to take action on, but call them. If it's something that you don't do business with, delete it right away. All right, in the interest of time, are you sure? Okay. An administrator account. Think of an administrator account as a master key to a house, and let you be the master. So when you buy a new computer, or if you have a computer, you should always set it up with an administrator account. And then once you do all that, you can select different people in your household or in your family that would have access, but to their own profile. So you hold the master key, but then you assign them different accesses that they can. We have this at the police department, and actually our administrator is right here. So when we have a new police officer, the new police officer will get credentials to our computer system, but not all the credentials, not the ability to add and remove people, right? Not the ability to change the settings of a computer system. Only in the areas that they need to go to. So, and as that area of responsibility expands, we would give them more privileges. Once you set up everything with your administrator account, give yourself your own user account, and then use the user account day to day, and leave that administrator account only if you need to make changes to the whole system. Does that make sense? So you're going to give yourself the master key, set everything up, give yourself a regular key, give your family or whoever else in the building that you want to a regular key, and then leave that administrator account only for you to use, and then use the day-to-day one that you have set up for yourself anyway. That way you won't risk anything getting changed on your system without your knowledge. Just think of an administrator account as a master key, all right? And that's how you would do that. When you set it up, it'll ask you, are you going to set up this person as an administrator, a user, a guest? Those types of things. Who uses password managers? Okay, after today, when you go home, I hope all of you are going to consider using a password manager. Because a password manager is one of these, and there's many out there, and what they do is they hold all your passwords in a secure database that only you can have access to. If you use Google and you may already actually use a password manager. If you log into, let's say, Netflix, if you have Netflix, and you want to save your profile so that every time you don't have to put your password in, right? It pre-populates for you when you log in. That's, in a sense, a password manager, and it's being done for you, and it's pretty secure. Now, here's my disclaimer. As a police officer, I'm not allowed to recommend, endorse, or suggest the use of any private company. However, there's a bunch of password manager systems that you may want to explore. If you use Google, you already get it for free. If you have an Apple product, you probably already have it for free. If you feel like you want to help out these businesses, you can look at what they have to offer. They essentially do the same exact thing, they just have different names. This is the same as if you wanted to use a travel service like Expedia, Travelocity, Orbitz, or any of those. They all do the same exact thing, they're just in a different name. They may cost a little bit different, they may have different plans available to them. Yes?
So do you have to enter those passwords, or is it done automatically?
You enter the password, and it saves it for you.
Okay.
And then if you want to make changes to it.
No, I mean, do you have to click on the icon for that Apple?
To set it up, you would.
Okay.
And then it'll sit, so then when you go to one of the sites that you normally go to, it might say, you might get an alert. We notice you're going to this website again. Do you want to use your password that you have saved?
Okay.
Or something like that.
Okay.
It's difficult for me to explain it to you how it actually works, but they're very easy to understand and very easy to use.
Okay.
And by and large, they're very safe and secure. Okay, strong passwords. I know they're a pain in the butt. And at the police department, we have to change our password every 4 months. So 3 times a year. I thought it was this. No, it's not that one, you ding dong. It slaps you kind of in the face. No, try again. Nope. Hey, you keep making the same mistake and you're going to get locked up for 24 hours. Oh, great. Then I'll have to explain to the chief why I can't finish that report for 24 hours. No, I'm not going to do that. So always try to use a strong password. This is what a strong password looks like. See what I did there? Easy for me to remember, just change it up a little bit. Okay? If you're really daring, this is another one that I like. See now with the 617 area code, Boston? Well, now there's 781 and 774. Can't have just one, they gotta have 3. So strong passwords are really important. And a lot of places require them. A lot of places require strong passwords. So this is why password managers are so effective. The average person has, how many passwords do you think the average person has? 25. It's about 217. 217, the average person, right? And I'm sure some people have more and some people have a few. That's why there's such a high average. But it's unbelievable. And some that you don't even really know about. And some that you may have for multiple sites you visit. Okay, so what's the idea of this weird picture right here, these 2 weird pictures? Strong passwords should be used even if you use a password manager. Think of a strong password as your seatbelt and your password manager as your airbag. It's a secondary system to help you stay safe, right? Even if your car has airbags, we're still gonna want you to use your seatbelt because the seatbelt is the primary way that's gonna keep you safe. Airbag is just secondary, so you should definitely use both if you can. Multi-factor authentication. This is 2-factor authentication. It either can come to you in an email or in a text message to your trusted phone. When you're trying to log into Home Depot, you want to make a purchase on Home Depot because you're going to be driving through, you just want to stop in, pick up your new door lock, and go. You don't want to walk through the whole store. You just want to do an online order you can pick up, right? So you go to Home Depot, it says, hey, we noticed that you're coming back to buy something, but before we let you proceed, we're going to send you an email with a code that we want you to tell us what the code is. We're only going to give you that code. It's only going to be good for 12 minutes. Enter it here when you get it. So you get it, and you log in with the code, and they say, great, thank you for verifying you are who you say you are. Now let's go shopping and buy you a new door lock.
I use facial recognition on my iPad.
Perfect.
Just, that's good.
Even better. As long as you don't have a twin.
Which I don't.
Yeah. So facial recognition and biometrics, the thumbprint or the fingerprint, those are becoming industry standard access control points. So you're going to see a lot of that change. It used to be on the old iPhone where you had the little, down at the bottom, you had a little place for your thumb. You could put your thumb in. If you didn't have it just exactly right, it wasn't going to let you in. Now they use facial recognition. My son was trying to download a new app for his iPad, and we have to approve every app that he gets. So I'm sitting there watching hockey one day, and all of a sudden his iPad whips in front of my face. What are you doing? He's like, I need your facial recognition. Well, don't you slap it in front of my face like that. It's a great way to get hurt, kid. So facial recognition and the thumbprint are coming around. You're going to see those if you haven't already. Okay, so the 3-2-1 strategy doesn't really have a whole lot to do with counting. What it means is, if you have important documents, you should have 3 copies of them. Because if you only have 1 copy and something happens to it, you're bumming. If you have 2 and something happens to the original, and then you gotta say, well, where's the spare? Could be in trouble. So they say 3. 3 is the number of copies of important documents to have. On 2 different media types. So if you want to save it onto your computer, great, that's perfect. But also put it on one of those little flash drives. Well, if I pull the flash drive out, we're not going to see that slideshow anymore. So, but you know what I mean. Save it to your computer and save it to a flash drive or some other type of media. And one secured somewhere off-site. Now that's a picture of a bank deposit box. You maybe don't have to go to that extreme, but if you have a safe in your house, or if you have a relative or a close friend that lives nearby, maybe you can bring a care package over to them and say, could you just keep this secure for me? This is my extra stuff. Maybe you can do this. It's like when you lived in an apartment and you know the guy down the hall had the key to your place and you had the key to their place just in case either one of you ever got locked out. It's almost the same idea. So 3 copies of important documents, use 2 different types of media, and 1 should be secured off-site. That's the 3-2-1 rule for important documents. Okay, so what is social engineering? Anyone? All right, I usually do an experiment here, but I'm not going to do it today, where I ask you to tell me what a... Well, do we have time? How much time do we have?
You're good.
I have 10 minutes? Okay. So I'm going to pick on someone.
Go that way.
Go that way. Yeah, you've already played this game. You've already
picked
played
on
this
enough.
game. Who wants to play? I'm not going to pick anybody who doesn't want to. Mark Keller. Thank you, sir. Mark, you play cards?
Sure.
Okay. So in a standard deck of cards, there is the jack, the queen, the king, and the ace, right?
Yes.
So I want you to pick 2. Hold on a second. Okay? I want you to pick 2 and tell me what they are.
Right now?
Yeah, jack, queen, king, ace.
The jack of hearts, the king.
No, just the card. Jack, queen, king, or ace, not the suit.
Oh, okay. Jack and a king.
Jack and a king. That leaves ace and queen. So pick one of those.
Queen.
Queen. That leaves ace.
Right.
Now there's heart, spade, diamond, club. Pick 2. Tell me what they are.
Clubs and spades.
Clubs and spades. Pick one of those.
Clubs.
Clubs. That leaves spades. So ace of spades is his card. What did I tell you?
Ace of spades.
I made him pick the ace of spades. Okay? All right. Let's try it again. We'll do it a little slower this time.
Okay.
Jack, queen, king, ace. Pick 2. Tell me what they are.
Queen and king.
Queen and king. That leaves ace and jack. Pick one of those.
Jack.
That leaves ace. Heart, diamond, spade, club. Pick 2. Tell me what they are.
Heart and club.
Heart and club. That leaves spade and diamond. Right? Pick one of those.
Diamond.
Diamond. That leaves spade. He tried everything to avoid that ace of spades, but he got stuck with it. Actually, by the way, it's a good card to have if you're playing cards.
I guess so. You don't sell cars, do you? Used cars?
No, not until after 4 o'clock when I'm done. That's an example of social engineering. Thank you, Mark, for participating. That's just a quick way of showing how easy it is to make you do something that you don't really know you're doing that I want you to do. This can play out in the grandparent scheme. Have you heard of the grandparent scheme? So this is when an unknown caller calls, and we call it the grandparent scheme because they've been targeted. Grandparents have been targeted significantly on this. This is when the phone rings and you answer it and they say, "Hi, I'm with the police department in Toronto, Canada. Your grandson has gotten himself in trouble." David or Alex? Alex. Now, I may not have known what your grandkids' names were, but you just told me. Now I'm going to start calling Alex by Alex. Yeah, Alex needs your help. And Alex knows that you don't want to see him get in trouble. That's why he's calling you and not his parents, because he came to Toronto to see some friends, and his parents said that they really didn't want him to do that. And Alex hopes that you'll send him the money that he needs to get out of jail and not tell his parents until he's ready to come back to the States. How much do you need and where do I send it? Because I love my grandson Alex, right? That's one way that they get your confidence. That's just another quick example. And Alex knows he can trust you as a grandparent. You're the favorite grandparent. And then the checkbook and the credit card gets opened up, and you'll never see that money again. So beware of calls like that. Last but not least, who likes to travel? Yes, okay. So always have a copy of your important travel documents, including your IDs and your itineraries. Make a copy of your passport and keep it with you. If you lose your passport when you're traveling abroad, that's an inconvenience. You're still probably going to be able to travel sometime. But if you have a copy of your passport, at least you have that to help you start the process of getting back to the States and getting your passport replaced. Credit or currency. This is it depends on where you're going. If you're traveling overseas, it's best to use a credit card because credit card companies usually have a lot more protections than cash does. Once cash is gone, you're not going to see it again. Credit cards, you may be able to get reimbursed if there's been fraud on your account. However, do yourself a favor and make sure that the credit card that you're traveling with doesn't have foreign transaction fees, because that'll make what you thought was a moderately expensive trip to be a very expensive trip really quickly. And browse cautiously. If you're overseas and you need to get online to do any banking, you should have picked another time to go on vacation. When you're on vacation, don't do banking, especially with an overseas computer network, because you don't know if you can trust it or if you can't trust it. But if you need to do a boarding pass or something to help you travel, just be careful where you browse and that you use it at a reputable place like a decent hotel. Airports, I don't think they have computers anymore, but they have networks. Speaking of that, when you're traveling, we all have our devices now that need to be charged. So, are you going to use this one to charge in a hotel, or are you going to use this one to charge in a hotel? Right? Pick one. The one on the right, the one that's circled? Who said no? Why aren't you going to use the one that's circled?
Because the one that you're using there is direct line to the computer versus the phone plug-in, you have to use a power switch.
See? I didn't plant him, but he's seen enough of this to know the right answer. Yes. This transfers electricity and power. That's it. This transfers electricity and power and also has the potential to transfer data. So you could not know that your data is being sucked away from your device. Same with this in the airplane. Now they have these between each seat, right? You want to charge if you need to with this one, not this one. That's a USB jack. That'll transfer it can transfer your data. Now I'm not saying that it's going to, but it can. So if you have the option of using the one that brings your risk way down, that's the one you want to use. So buy yourself one of these little power strips. They're inexpensive, they fold up, they have all different types of abilities and adapter capabilities. I can't recommend any one, but let's just say there's a jungle out there of places like a jungle as big as the Amazon, and you might be able to find something fairly inexpensive that suits your needs. And that's just some more pictures of the same. You know, they've got them built into the credenzas now at the hotels. They're everywhere. And that's what they look like on the back of a computer. Right? Seen all those, right? And then lastly, always get your credit report free. A lot of your credit cards will offer to you credit monitoring for free. You can just click on your credit card company and they'll give you your credit report. If you want to be really slick, like I try to be, you're allowed to get one free credit report from each of the 3 major credit reporting agencies annually. Well, on January 1st, I send my email to Experian to get it from them. Then in April, I send it to TransUnion. And then in September, I send it to Equifax. So I get 3 every year, and I compare them to make sure that everything's legitimate. So I'd rather space it out during the year because a lot can happen in 3 or 4 months. And they're great to keep an eye on. And for those of you that were taking pictures of slides, there's the slide you want to take the picture of. Your 10 takeaways from today. Ooh, did it. Did it.
2 minutes.
You have questions though, come on now.
Yes.
When my husband and I go away, what we normally do is we each take the same credit cards and then we each carry one different credit card. If somebody's wallet gets stolen, then we still have one credit card that hasn't gotten stolen.
Great. That's a very good strategy to minimize your risk. I like it. Yes.
Don't use the debit card because it's a direct.
Oh yeah.
It's directly to your bank account.
I should have.
It's not a card.
I should have specified credit cards, not debit cards. Debit cards, that's your money, right? That's your money that you're gambling with, not gambling with, but that you're using. Credit card is somebody else's money, and they're protected. I mean, yeah, they're going to pass that on to all consumers after that, but you're not going to be out any money if you didn't do any wrongdoing or you didn't have any wrongdoing in the loss or theft of your credit card. You don't want my picture, won't you? Does anybody have any questions?
So that phone number you gave us for the credit report, what does that, where does that get?
That's free credit report. That's annualcreditreport.com. These are the 3 ways that you can get those credit reports.
So you can get all 3 from that one phone number?
Yes. Yep.
Just one at a time. January.
Well, that's how I do it. You can do it however you want, but I'm always looking for an angle. I'm always looking for an angle.
No, regarding phone calls.
Phone calls.
We get phony calls about Medicare, saying I'm calling for Medicare, and they never call.
Right.
I get them all the time.
Yeah, talking about fraudulent calls claiming to be from Medicare.
Plastic Medicare card, have you gotten your new one yet?
Yes.
No, you call them. They don't need to call
Right.
you.
That's right.
Hello, I'm calling from Medicare. My name is Harry.
Exactly.
We play with them sometimes.
I got very closely taken by one of these scams one time, and fortunately, I had an older computer that was running very slow. It was on my computer and the phone. And the fellow said, your computer's slow, why is it so slow? And all of a sudden I said, I shut it off. And he said, you shut off your computer? I said, yes, there's too many accents. But I still went in and changed my bank account.
Yeah. Yeah,
Immediately.
if you ever believe that you've been victimized or if you fall into a scam, go to your bank right away, and they're probably going to tell you to come see us. Okay? There's steps in place to help you if you feel like you've been taken advantage of, and it could be changing account numbers. And while that is an inconvenience, the inconvenience of that compared to actually being scammed and losing your money is nothing. So deal with the minor inconvenience if you feel like you've been scammed.
Because I shut my computer off, it cut it off before it finished. So it never really went through, but I wasn't sure, so I wasn't going to take that risk.
And there's some pamphlets over there too regarding some of that stuff with your social security number. If you accidentally gave it out, now what do you do? If you gave out your date of birth, oh, now what do you do? Different agencies to flag your account, to notify social security, so they'll notify you if anything else new opens on your account, so you can obey it. Because things do happen. I mean, we've had people where they get the phone call and they're on the phone, and the person will talk them through they'll stay on the phone with you the whole time as you drive all the way to CVS to buy that gift card, to give them the number on the back. And they'll, are you there yet? Are you there yet? And they're persistent, and they'll keep trying everything, and everything that sort of message just taught you will change in a few months, and they'll find something new.
You're gonna come back?
Yeah. Well, thank you so much. And thank all of you guys. Thank you so much for coming to the first public safety seminar, and a round of applause for our presenters again. We really appreciate your time, and we'll be here for a few minutes if you guys have any last questions, but enjoy the rest of your day. Thanks for coming.
Before you guys leave, big shout out to Anna for putting this whole thing together. All of us, but she put in a ton of work behind the scenes. She took care of the lunch and the scheduling, so without her, this wouldn't have happened.